Take, and take necessary measures to prevent infection. D. Encourage the patient to increase his fluid intake, use non-irritating soap when bathing the patient, and apply lotion to the involved areas. Question 1 Answer: D. Encourage the patient to increase his fluid intake, use non-irritating soap when bathing the patient, and apply lotion to the involved areas. Question 1 Explanation: Dry skin will eventually crack, ranking the patient more prone to infection. To prevent this, the nurse should provide adequate hydration through fluid intake, use non-rotating soaps or no soap when bathing the patient, and lubricate the patient's skin with lotion. Bathing may be limited but need not be avoided entirely. The attending physician and dietitian may be consulted for treatment, but home laundered items usually are not necessary. Question 2 When bathing a patient's extremities, the nurse should use long, firm strokes from the distal to the proximal areas. This technique: A. Provides an opportunity for skin assessment. B. Avoids undue strain on the nurse. C. Increases venous blood return. D. Causes vasoconstriction and increases circulation. Question 2 Answer: C. Increases venous blood return. Question 2 Explanation: Washing from distal to proximal areas stimulates venous blood flow, thereby preventing venous stasis. It improves circulation but does not result in vasoconstriction. The nurse can assess the patient's condition throughout the bath, regardless of washing technique, and should feel no strain while bathing the patient. Question 3 Vivid dreaming occurs in which stage of sleep? A. Stage I non-REM. B. Rapid eye movement, REM, stage. C. Stage 2 non-REM. D. Delta stage. Question 3 Answer: B. Rapid eye movement, REM, stage. Question 3 Explanation: Other characteristics of rapid eye movement, REM, sleep are deep sleep, the patient cannot be awakened easily, depressed muscle tone, and possibly irregular heart and respiratory rates. Non-REM sleep is a deep, restful sleep without dreaming. Delta stage, or slow-wave sleep, occurs during non-REM stages 3 and 4 and is often equated with quiet sleep. Question 4 The natural sedative in meat and milk products, especially warm milk, that can help induce sleep is: A. Flurazepam. B. Temazepam. C. Tryptophan. D. Methotrimpresine. Question 4 Answer: C. Tryptophan. Question 4 Explanation: Tryptophan is a natural sedative, flurazepam, Dalmane, temazepam, Restoril, and methotrimpresine, Levopram, are hypnotic sedatives. Question 5 Nursing interventions that can help the patient to relax and sleep restfully include all of the following except: A. Have the patient take a 30 to 60 minute nap in the afternoon. B. Turn on the television in the patient's room. C. Provide quiet music and interesting reading material. D. Massage the patient's back with long strokes. Question 5 Answer: A. Have the patient take a 30 to 60 minute nap in the afternoon. Question 5 Explanation: Napping in the afternoon is not conducive to nighttime sleeping. Quiet music, watching television, reading, and massage usually will relax the patient, helping him to fall asleep. Question 6 Restraints can be used for all of the following purposes except to: A. Prevent a confused patient from removing tubes, such as feeding tubes, IV lines, and urinary catheters. B. Prevent a patient from falling out of bed or a chair. C. Discourage a patient from attempting to ambulate alone when he requires assistance for his safety. D. Prevent a patient from becoming confused or disoriented. Question 6 Answer: D. Prevent a patient from becoming confused or disoriented. Question 6 Explanation: By restricting a patient's movements, restraints may increase stress and lead to confusion, rather than prevent it. The other choices are valid reasons for using restraints. Question 7 Which of the following is the nurse's legal responsibility when applying restraints? A. Document the patient's behavior. B. Document the type of restraint used. C. Obtain a written order from the physician except in an emergency, when the patient must be protected from injury to himself or others. D. All of the above. Question 7 Answer: D. All of the above. Question 7 Explanation: When applying restraints, The nurse must document the type of behavior that prompted her to use them, document the type of restraints used, and obtain a physician's written order for the restraints. Question 8. Kubler-Ross's 5 successive stages of death and dying are: A. Anger, bargaining, denial, depression, acceptance. B. Denial, anger, depression, bargaining, acceptance. C. Denial, anger, bargaining, depression, acceptance. D. Bargaining, denial, anger, depression, acceptance. Question 8. Answer: C. Denial, anger, bargaining, depression, acceptance. Question 8. Explanation: Kubler-Ross's 5 successive stages of death and dying are denial, anger, bargaining, depression, and acceptance. The patient may move back and forth through the different stages as he and his family members react to the process of dying, but he usually goes through all of these stages to reach acceptance. Question 9. A terminally ill patient usually experiences all of the following feelings during the anger stage except: A. Rage. B. Envy. C. Numbness. D. Resentment. Question 9. Answer: C. Numbness. Question 9. Explanation: Numbness is typical of the depression stage, when the patient feels a great sense of loss. The anger stage includes such feelings as rage, envy, resentment, and the patient's questioning "why me?" Question 10. Nurses and other healthcare providers often have difficulty helping a terminally ill patient through the necessary stages leading to acceptance of death. Which of the following strategies is most helpful to the nurse in achieving this goal? A. Taking psychology courses related to gerontology. B. Reading books and other literature on the subject of thanatology. C. Reflecting on the significance of death. D. Reviewing varying cultural beliefs and practices related to death. Question 10. Answer: C. Reflecting on the significance of death. Question 10. Explanation: According to thanatologists, reflecting on the significance of death helps to reduce the fear of death and enables the healthcare provider to better understand the terminally ill patient's feelings. It also helps to overcome the belief that medical and nursing measures have failed, when a patient cannot be cured. Question 11. Which of the following symptoms is the best indicator of imminent death? A. A weak, slow pulse. B. Increased muscle tone. C. Fixed, dilated pupils. D. Slow, shallow respirations. Question 11. Answer: C. Fixed, dilated pupils. Question 11. Explanation: Fixed, dilated pupils are sign of imminent death. Pulse becomes weak but rapid, muscles become weak and atonic, and periods of apnea occur during respiration. Question 12. A nurse caring for a patient with an infectious disease who requires isolation should refers to guidelines published by the A. National League for Nursing, NLN. B. Centers for Disease Control, CDC. C. American Medical Association, AMA. D. American Nurses Association, ANA. Question 12. Answer: B. Centers for Disease Control, CDC. Question 12. Explanation: The Center of Disease Control, CDC, publishes and frequently updates guidelines on caring for patients who require isolation. The National League of Nursing's, NLN's, major function is accrediting nursing education programs in the United States. The American Medical Association, AMA, is a national organization of physicians. The American Nurses Association, ANA, is a national organization of registered nurses. Question 13. To institute appropriate isolation precautions, the nurse must first know the A. organism's mode of transmission. B. organism's gram-staining characteristics. C. organism's susceptibility to antibiotics. D. patient's susceptibility to the organism. Question 13. Answer: A organism's mode of transmission. Question 13. Explanation: Before instituting isolation precaution, the nurse must first determine the organism's mode of transmission. For example, an organism transmitted through nasal secretions requires that the patient be kept in respiratory isolation, which involves keeping the patient in a private room with the door closed and wearing a mask, a gown, and gloves when coming in direct contact with the patient. The organism's gram-straining characteristics reveal whether the organism is gram-negative or gram-positive, an important criterion in the physician's choice for drug therapy and the nurse's development of an effective plan of care. The nurse also needs to know whether the organism is susceptible to antibiotics, but this could take several days to determine. If she waits for the results before instituting isolation precautions, the organism could be transmitted in the meantime. The patient's susceptibility to the organism has already been established. The nurse would not be instituting isolation precautions for a non-infected patient. Question 14. Which is the correct procedure for collecting a sputum specimen for culture and sensitivity testing? A. Have the patient place the specimen in a container and enclose the container in a plastic bag. B. Have the patient expectorate the sputum while the nurse holds the container. C. Have the patient expectorate the sputum into a sterile container. D. Offer the patient an antiseptic mouthwash just before he expectorate the sputum. Question 14. Answer: C. Have the patient expectorate the sputum into a sterile container. Question 14. Explanation: placing the specimen in a sterile container ensures that it will not become contaminated. The other answers are incorrect because they do not mention sterility and because antiseptic mouthwash could destroy the organism to be cultured. Before sputum collection, the patient may use only tap water for nursing the mouth. Question 15. An autoclave is used to sterilize hospital supplies because A. More articles can be sterilized at a time. B. Steam causes less damage to the materials. C. A lower temperature can be obtained. D. Pressurized steam penetrates the supplies better. Question 15. Answer: D. Pressurized steam penetrates the supplies better. Question 15. Explanation: An autoclave, an apparatus that sterilizes equipment by means of high-temperature pressurized steam, is used because it can destroy all forms of microorganisms, including spores. Question 16. The best way to decrease the risk of transferring pathogens to a patient when removing contaminated gloves is to A. Wash the gloves before removing them. B. Gently pull on the fingers of the gloves when removing them. C. Gently pull just below the cuff and invert the gloves when removing them. D. Remove the gloves and then turn them inside out. Question 16. Answer: C. Gently pull just below the cuff and invert the gloves when removing them. Question 16. Explanation: Turning the gloves inside out while removing them keeps all contaminants inside the gloves. They should then be placed in a plastic bag with soiled dressings and discarded in a soiled utility room garbage pail, double-bagged. The other choices can spread pathogens within the environment. Question 17. After having an IV line in place for 72 hours, a patient complains of tenderness, burning, and swelling. Assessment of the IV site reveals that it is warm and erythematous. This usually indicates A. Infection, B. Infiltration, C. Phlebitis, D. Bleeding. Question 17. Answer: C. Phlebitis. Question 17. Explanation: Tenderness, warmth, swelling, and, in some instances, a burning sensation are signs and symptoms of phlebitis. Infection is less likely because no drainage or fever is present. Infiltration would result in swelling and pallor, not erythema, near the insertion site. The patient has no evidence of bleeding. Question 18. To ensure homogenization when diluting powdered medication in a vial, the nurse should A. Shake the vial vigorously. B. Roll the vial gently between the palms. C. Invert the vial and let it stand for 1 minute. D. Do nothing after adding the solution to the vial. Question 18. Answer: B. Roll the vial gently between the palms. Question 18. Explanation: Gently rolling a sealed vial between the palms produces sufficient heat to enhance dissolution of a powdered medication. Shaking the vial vigorously can break down the medication and alter its pharmacologic action. Inverting the vial or leaving it alone does not ensure thorough homogenization of the powder and the solvent. Question 19. The nurse is teaching a patient to prepare a syringe with 40 units of U-100 NPH insulin for self-injection. The patient's first priority concerning self-injection in this situation is to A. Assess the injection site. B. Select the appropriate injection site. C. Check the syringe to verify that the nurse has removed the prescribed insulin dose. D. Clean the injection site in a circular manner with alcohol sponge. Question 19. Answer: C. Check the syringe to verify that the nurse has removed the prescribed insulin dose. Question 19. Explanation: when the nurse teaches the patient to prepare an insulin injection, the patient's first priority is to validate the dose accuracy. The next steps are to select the site, assess the site, and clean the site with alcohol before injecting the insulin. Question 20. The physician's order reads administer 1 gram cefazolin sodium, ANSEV, in 150 milliliters of normal saline solution in 60 minutes. What is the flow rate if the drop factor is 10 GTT equals 1 milliliter? A. 25 GTT, minute. B. 37 GTT, minute. C. 50 GTT, minute. D. 60 GTT, minute. Question 20. Answer: a 25 GTT, minute. Question 20. Explanation: 25 GTT, minute. Question 21. A patient must receive 50 units of Humulin regular insulin. The label reads 100 units equals 1 milliliter. How many milliliters should the nurse administer? A. 0.5 milliliters. B. 0.75 milliliters. C. 1 milliliter. D. 2 milliliters. Question 21. Answer: a 0.5 milliliters. Question 21. Explanation: 0.5 milliliters. Question 22. How should the nurse prepare an injection for a patient who takes both regular and NPH insulin? A. Draw up the NPH insulin, then the regular insulin, in the same syringe. B. Draw up the regular insulin, then the NPH insulin, in the same syringe. C. Use 2 separate syringe. D. Check with the physician. Question 22. Answer: B. Draw up the regular insulin, then the NPH insulin, in the same syringe. Question 22. Explanation: drugs that are compatible may be mixed together in one syringe. In the case of insulin, the shorter-acting, clear insulin, regular, should be drawn up before the longer-acting, cloudy insulin, NPH, to ensure accurate measurements. Question 23. A patient has just received 30 milligrams of codeine by mouth for pain. 5 minutes later he vomits. What should the nurse do first? A. Call the physician. B. Remedicate the patient. C. Observe the emesis. D. Explain to the patient that she can do nothing to help him. Question 23. Answer: C. Observe the emesis. Question 23. Explanation: after a patient has vomited, the nurse must inspect the emesis to document color, consistency, and amount. In this situation, the patient recently ingested medication, so the nurse needs to check for remnants of the medication to help determine whether the patient retained enough of it to be effective. The nurse must then notify the physician, who will decide whether to repeat the dose or prescribe an antiemetic. Question 24. A patient is characterized with a number 16 indwelling urinary, Foley, catheter to determine if A. trauma has occurred. B. His 24-hour output is adequate. C. He has a urinary tract infection. D. Residual urine remains in the bladder after voiding. Question 24. Answer: B. His 24-hour output is adequate. Question 24. Explanation: a 24-hour urine output of less than 500 milliliters in an adult is considered inadequate and may indicate kidney failure. This must be corrected while the patient is in the acute state so that appropriate fluids, electrolytes, and medications can be administered and excreted. Indwelling catheterization is not needed to diagnose trauma, urinary tract infection, or residual urine. Question 25. A staff nurse who is promoted to assistant nurse manager may feel uncomfortable initially when supervising her former peers. She can best decrease this discomfort by A. Writing down all assignments. B. Making changes after evaluating the situation and having discussions with the staff. C. Telling the staff nurses that she is making changes to benefit their performance. D. Evaluating the clinical performance of each staff nurse in a private conference. Question 25 Answer: B. Making changes after evaluating the situation and having discussions with the staff. Question 25 Explanation: A new assistant nurse manager should not make changes until she has had a chance to evaluate staff members, patients, and physicians. Changes must be planned thoroughly and should be based on a need to improve conditions, not just for the sake of change. Written assignments allow all staff members to know their own and others' responsibilities and serve as a checklist for the manager, enabling her to gauge whether the unit is being run effectively and whether patients are receiving appropriate care. Telling the staff nurses that she is making changes to benefit their performance should occur only after the nurse has made a thorough evaluation. Evaluations are usually done on a yearly basis or as needed. Question 26. Nurse Clarice is teaching a patient about a newly prescribed drug. What could cause a geriatric patient to have difficulty retaining knowledge about prescribed medications? A. Decreased plasma drug levels. B. Sensory deficits. C. Lack of family support. D. History of Tourette syndrome. Question 26 Answer: B. Sensory deficits. Question 26 Explanation: Sensory deficits could cause a geriatric patient to have difficulty retaining knowledge about prescribed medications. Decreased plasma drug levels do not alter the patient's knowledge about the drug. A lack of family support may affect compliance, not knowledge retention. Tourette syndrome is unrelated to knowledge retention. Question 27. When examining a patient with abdominal pain, the nurse in charge should assess A. Any quadrant first. B. The symptomatic quadrant first. C. The symptomatic quadrant last. D. The symptomatic quadrant either second or third. Question 27 Answer: C. The symptomatic quadrant last. Question 27 Explanation: The nurse should systematically assess all areas of the abdomen, if time and the patient's condition permit, concluding with the symptomatic area. Otherwise, the nurse may elicit pain in the symptomatic area, causing the muscles in other areas to tighten. This would interfere with further assessment. Question 28. The nurse is assessing a postoperative adult patient. Which of the following should the nurse document as subjective data? A. Vital signs. B. Laboratory test result. C. Patient's description of pain. D. Electrocardiographic, ECG, waveforms. Question 28 Answer: C. Patient's description of pain. Question 28 Explanation: Subjective data come directly from the patient and usually are recorded as direct quotations that reflect the patient's opinions or feelings about a situation. Vital signs, laboratory test result, and ECG waveforms are examples of objective data. Question 29. A male patient has a soft wrist safety device. Which assessment finding should the nurse consider abnormal? A. A palpable radial pulse. B. A palpable ulnar pulse. C. Cool, pale fingers. D. Pink nail beds. Question 29 Answer: C. Cool, pale fingers. Question 29 Explanation: A safety device on the wrist may impair circulation and restrict blood supply to body tissues. Therefore, the nurse should assess the patient for signs of impaired circulation, such as cool, pale fingers. A palpable radial or lunar pulse and pink nail beds are normal findings. Question 30. Which of the following planes divides the body longitudinally into anterior and posterior regions? A. Frontal plane. B. Sagittal plane. C. Mid-sagittal plane. D. Transverse plane. Question 30 Answer: A frontal plane. Question 30 Explanation: Frontal or coronal plane runs longitudinally at a right angle to a sagittal plane, dividing the body in anterior and posterior regions. A sagittal plane runs longitudinally, dividing the body into right and left regions. If exactly midline, it is called a mid-sagittal plane. A transverse plane runs horizontally at a right angle to the vertical axis, dividing the structure into superior and inferior regions. Question 31. A female patient with a terminal illness is in denial. Indicators of denial include A. Shock dismay. B. Numbness. C. Stoicism. D. Preparatory grief. Question 31 Answer. A shock dismay. Question 31 Explanation. Shock and dismay are early signs of denial, the first stage of grief. The other options are associated with depression, a later stage of grief. Question 32. The nurse in charge is transferring a patient from the bed to a chair. Which action does the nurse take during this patient transfer? A. Position the head of the bed flat. B. Helps the patient dangle the legs. C. Stands behind the patient. D. Places the chair facing away from the bed. Question 32 Answer. B. Helps the patient dangle the legs. Question 32 Explanation. After placing the patient in high Fowler's position and moving the patient to the side of the bed, the nurse helps the patient sit on the edge of the bed and dangle the legs. The nurse then faces the patient and places the chair next to and facing the head of the bed. Question 33. A female patient who speaks a little English has emergency gallbladder surgery. During discharge preparation, which nursing action would best help this patient understand wound care instruction? A. Asking frequently if the patient understands the instruction. B. Asking an interpreter to replay the instructions to the patient. C. Writing out the instructions and having a family member read them to the patient. D. Demonstrating the procedure and having the patient return the demonstration. Question 33 Answer. D. Demonstrating the procedure and having the patient return the demonstration. Question 33 Explanation. Demonstrating by the nurse with a return demonstration by the patient ensures that the patient can perform wound care correctly. Patients may claim to understand discharge instruction when they do not. An interpreter or family member may communicate verbal or written instructions inaccurately. Question 34. Before administering the evening dose of a prescribed medication, the nurse on the evening shift finds an unlabeled, filled syringe in the patient's medication drawer. What should the nurse in charge do? A. Discard the syringe to avoid a medication error. B. Obtain a label for the syringe from the pharmacy. C. Use the syringe because it looks like it contains the same medication the nurse was prepared to give. D. Call the day nurse to verify the contents of the syringe. Question 34 Answer. A. Discard the syringe to avoid a medication error. Question 34 Explanation. As a safety precaution, the nurse should discard an unlabeled syringe that contains medication. The other options are considered unsafe because they promote error. Question 35. When administering drug therapy to a male geriatric patient, the nurse must stay especially alert for adverse effects. Which factor makes geriatric patients to adverse drug effects? A. Faster drug clearance. B. Aging-related physiological changes. C. Increased amount of neurons. D. Enhanced blood flow to the GI tract. Question 35 Answer. B. Aging-related physiological changes. Question 35 Explanation. Aging-related physiological changes account for the increased frequency of adverse drug reactions in geriatric patients. Renal and hepatic changes cause drugs to clear more slowly in these patients. With increasing age, neurons are lost and blood flow to the GI tract decreases. Question 36. A female patient is being discharged after cataract surgery. After providing medication teaching, the nurse asks the patient to repeat the instructions. The nurse is performing which professional role? A. Manager. B. Educator. C. Caregiver. D. Patient advocate. Question 36 Answer. B. Educator. Question 36 Explanation. When teaching a patient about medications before discharge, the nurse is acting as an educator. The nurse acts as a manager when performing such activities as scheduling and making patient care assignments. The nurse performs the caregiving role when providing direct care, including bathing patients and administering medications and prescribed treatments. The nurse acts as a patient advocate when making the patient's wishes known to the doctor. Question 37. A female patient exhibits signs of heightened anxiety. Which response by the nurse is most likely to reduce the patient's anxiety? A. Everything will be fine. Don't worry. B. Read this manual and then ask me any questions you may have. C. Why don't you listen to the radio? D. Let's talk about what's bothering you. Question 37. Answer: D. Let's talk about what's bothering you. Question 37. Explanation: anxiety may result from feeling of helplessness, isolation, or insecurity. This response helps reduce anxiety by encouraging the patient to express feelings. The nurse should be supportive and develop goals together with the patient to give the patient some control over an anxiety-inducing situation. Because the other options ignore the patient's feeling and block communication, they would not reduce anxiety. Question 38. A scrub nurse in the operating room has which responsibility? A. Positioning the patient. B. Assisting with gowning and gloving. C. Handling surgical instruments to the surgeon. D. Applying surgical drapes. Question 38. Answer: C. Handling surgical instruments to the surgeon. Question 38. Explanation: the scrub nurse assists the surgeon by providing appropriate surgical instruments and supplies, maintaining strict surgical asepsis and, with the circulating nurse, accounting for all gauze, sponges, needles, and instruments. The circulating nurse assists the surgeon and scrub nurse, positions the patient, applies appropriate equipment and surgical drapes, assists with gowning and gloving, and provides the surgeon and scrub nurse with supplies. Question 39. A patient is in the bathroom when the nurse enters to give a prescribed medication. What should the nurse in charge do? A. Leave the medication at the patient's bedside. B. Tell the patient to be sure to take the medication, and then leave it at the bedside. C. Return shortly to the patient's room and remain there until the patient takes the medication. D. Wait for the patient to return to bed, and then leave the medication at the bedside. Question 39. Answer: C. Return shortly to the patient's room and remain there until the patient takes the medication. Question 39. Explanation: the nurse should return shortly to the patient's room and remain there until the patient takes the medication to verify that it was taken as directed. The nurse should never leave medication at the patient's bedside unless specifically requested to do so. Question 40. The physician orders heparin, 7,500 units, to be administered subcutaneously every 6 hours. The vial reads 10,000 units per milliliter. The nurse should anticipate giving how much heparin for each dose? A. 1/4 milliliter. B. 1/2 milliliter. C. 3/4 milliliter. D. 1 1/4 milliliter. Question 40. Answer: C. 3/4 milliliter. Question 40. Explanation: the nurse solves the problem as follows. 10,000 units / 7,500 units equals 1 milliliter / x 10,000 x equals 7,500 x equals 7,500 10,000ths or 3/4 milliliter. Question 41. The nurse in charge measures a patient's temperature at 102 degrees Fahrenheit. What is the equivalent centigrade temperature? A. 39 degrees C. B. 47 degrees C. C. 38.9 degrees C. D. 40.1 degrees C.Celsius. Question 41. Answer: C. 38.9 degrees Celsius. Question 41. Explanation: to convert Fahrenheit degrees to centigrade, use this formula. C degrees equals F degrees, 32, x 59. C degrees equals 102 to 32, 59 plus 70 by 59 38.9 degrees Celsius. Question 42. To evaluate a patient for hypoxia, the physician is most likely to order which laboratory test? A. Red blood cell count. B. Sputum culture. C. Total hemoglobin. D. Arterial blood gas, ABG, analysis. Question 42. Answer: D. Arterial blood gas, ABG, analysis. Question 42. Explanation: all of these tests help evaluate a patient with respiratory problems. However, ABG analysis is the only test to evaluate gas exchange in the lungs, providing information about patient's oxygenation status. Question 43. The nurse uses a stethoscope to auscultate a male patient's chest. Which statement about a stethoscope with a bell and diaphragm is true? A. The bell detects high-pitched sounds best. B. The diaphragm detects high-pitched sounds best. C. The bell detects thrills best. D. The diaphragm detects low-pitched sounds best. Question 43. Answer: B. The diaphragm detects high-pitched sounds best. Question 43. Explanation: the diaphragm of a stethoscope detects high-pitched sound best. The bell detects low-pitched sounds best. Palpation detects thrills best. Question 44. A male patient is to be discharged with a prescription for an analgesic that is a controlled substance. During discharge teaching, the nurse should explain that the patient must fill this prescription how soon after the date on which it was written? A. Within 1 month. B. Within 3 months. C. Within 6 months. D. Within 12 months. Question 44. Answer: C. Within 6 months. Question 44. Explanation: in most cases, an outpatient must fill a prescription for a controlled substance within 6 months of the date on which the prescription was written. Question 45. Which human element considered by the nurse in charge during assessment can affect drug administration? A. The patient's ability to recover. B. The patient's occupational hazards. C. The patient's socioeconomic status. D. The patient's cognitive abilities. Question 45. Answer: D. The patient's cognitive abilities. Question 45. Explanation: the nurse must consider the patient's cognitive abilities to understand drug instructions. If not, the nurse must find a family member or significant other to take on the responsibility of administering medications in the home setting. The patient's ability to recover, occupational hazards, and socioeconomic status do not affect drug administration. Question 46. An employer establishes a physical exercise area in the workplace and encourages all employees to use it. This is an example of which level of health promotion? A. Primary prevention. B. Secondary prevention. C. Tertiary prevention. D. Passive prevention. Question 46. Answer: a primary prevention. Question 46. Explanation: primary prevention precedes disease and applies to health patients. Secondary prevention focuses on patients who have health problems and are at risk for developing complications. Tertiary prevention enables patients to gain health from others' activities without doing anything themselves. Question 47. What does the nurse in charge do when making a surgical bed? A. Leaves the bed in the high position when finished. B. Places the pillow at the head of the bed. C. Rolls the patient to the far side of the bed. D. Tucks the top sheet and blanket under the bottom of the bed. Question 47. Answer: A. Leaves the bed in the high position when finished. Question 47. Explanation: when making a surgical bed, the nurse leaves the bed in the high position when finished. After placing the top linens on the bed without pouching them, the nurse fan folds these linens to the side opposite from where the patient will enter and places the pillow on the bedside chair. All these actions promote transfer of the postoperative patient from the stretcher to the bed. When making an occupied bed or unoccupied bed, the nurse places the pillow at the head of the bed and tucks the top sheet and blanket under the bottom of the bed. When making an occupied bed, the nurse rolls the patient to the far side of the bed. Question 48. The physician prescribes 250 mg of a drug. The drug vial reads 500 mg/ml. How much of the drug should the nurse give? A. 2 ml. B. 1 ml. C. 1/2 ml. D. 1/4 ml. Question 48. Answer: C. 1/2 ml. Question 48. Explanation: the nurse should give 1/2 ml of the drug. The dosage is calculated as follows: 250 mg/x equals 500 mg/1 ml. 500x equals 250x equals 1/2 ml. Question 49. Nurse Mackie is monitoring a patient for adverse reactions during barbiturate therapy. What is the major disadvantage of barbiturate use? A. Prolonged half-life. B. Poor absorption. C. Potential for drug dependence. D. Potential for hepatotoxicity. Question 49. Answer: C. Potential for drug dependence. Question 49. Explanation: patients can become dependent on barbiturates, especially with prolonged use. Because of the rapid distribution of some barbiturates, no correlation exists between duration of action and half-life. Barbiturates are absorbed well and do not cause hepatotoxicity, although existing hepatic damage does require cautious use of the drug because barbiturates are metabolized in the liver. Question 50. Which nursing action is essential when providing continuous enteral feeding? A. Elevating the head of the bed. B. Positioning the patient on the left side. C. Warming the formula before administering it. D. Hanging a full day's worth of formula at one time. Question 50. Answer: A. Elevating the head of the bed. Question 50. Explanation: Elevating the head of the bed during enteral feeding minimizes the risk of aspiration and allows the formula to flow in the patient's intestines. When such elevation is contraindicated, the patient should be positioned on the right side. The nurse should give enteral feeding at room temperature to minimize GI distress. To limit microbial growth, the nurse should hang only the amount of formula that can be infused in 3 hours. Question 51. When teaching a female patient how to take a sublingual tablet, the nurse should instruct the patient to place the table on the A. Top of the tongue, B. Roof of the mouth, C. Floor of the mouth, D. Inside of the cheek. Question 51. Answer: C. Floor of the mouth. Question 51. Explanation: The nurse should instruct the patient to touch the tip of the tongue to the roof of the mouth and then place the sublingual tablet on the floor of the mouth. Sublingual medications are absorbed directly into the bloodstream from the oral mucosa, bypassing the GI and hepatic systems. No drug is administered on top of the tongue or on the roof of the mouth. With the buccal route, the tablet is placed between the gum and the cheek. Question 52. Which action by the nurse in charge is essential when cleaning the area around a Jackson-Pratt wound drain? A. Cleaning from the center outward in a circular motion. B. Removing the drain before cleaning the skin. C. Cleaning briskly around the site with alcohol. D. Wearing sterile gloves and a mask. Question 52. Answer: A. Cleaning from the center outward in a circular motion. Question 52. Explanation: The nurse always should clean around a wound drain, moving from center outward in ever larger circles, because the skin near the drain site is more contaminated than the site itself. The nurse should never remove the drain before cleaning the skin. Alcohol should never be used to clean around a drain. It may irritate the skin and has no lasting effect on bacteria because it evaporates. The nurse should wear sterile gloves to prevent contamination, but a mask is not necessary. Question 53. The doctor orders dextrose 5% in water, 1,000 milliliters to be infused over 8 hours. The IV tubing delivers 15 drops per milliliter. The nurse in charge should run the IV infusion at a rate of A. 15 drop per minute, B. 21 drop per minute, C. 32 drop per minute, D. 125 drops per minute. Question 53. Answer: C. 32 drop per minute. Question 53. Explanation: Giving 1,000 milliliters over 8 hours is the same as giving 125 milliliters over 1 hour, 60 minutes. To find the number of milliliters per minute: 125 60ths minute equals x/1 minute. 60x equals 125x equals 2.1 milliliters/minute. To find the number of drops/minute: 2.1 milliliters/x GTTS equals 1 milliliter/15 GTTS. X equals 32 GTTS, minute, or 32 drops, minute. Question 54. A female patient undergoes a total abdominal hysterectomy. When assessing the patient 10 hours later, the nurse identifies which finding as an early sign of shock: A. Restlessness, B. Pale, warm, dry skin, C. Heart rate of 110 beats, minute, D. Urine output of 30 milliliters/hour. Question 54. Answer: A. Restlessness. Question 54. Explanation: Early in shock, hyperactivity of the sympathetic nervous system causes increased epinephrine secretion, which typically makes the patient restless, anxious, nervous, and irritable. It also decreases tissue perfusion to the skin, causing pale, cool, clammy skin. An above normal heart rate is a late sign of shock. A urine output of 30 ml/hour is within normal limits. Question 55. Which pulse should the nurse palpate during rapid assessment of an unconscious male adult? A. Radial. B. Brachial. C. Femoral. D. Carotid. Question 55. Answer: D. Carotid. Question 55. Explanation: during a rapid assessment, the nurse's first priority is to check the patient's vital functions by assessing his airway, breathing, and circulation. To check a patient's circulation, the nurse must assess his heart and vascular network function. This is done by checking his skin color, temperature, mental status and, most importantly, his pulse. The nurse should use the carotid artery to check a patient's circulation. In a patient with a circulatory problems or a history of compromised circulation, the radial pulse may not be palpable. The brachial pulse is palpated during rapid assessment of an infant. Question 56. Which intervention is an example of primary prevention? A. Administering digoxin, Lennoxacaps, to a patient with heart failure. B. Administering a measles, mumps, and rubella immunization to an infant. C. Obtaining a Peypanicle smear to screen for cervical cancer. D. Using occupational therapy to help a patient cope with arthritis. Question 56. Answer: B. Administering a measles, mumps, and rubella immunization to an infant. Question 56. Explanation: immunizing an infant is an example of primary prevention, which aims to prevent health problems. Administering digoxin to treat heart failure and obtaining a smear for a screening test are examples for secondary prevention, which promotes early detection and treatment of disease. Using occupational therapy to help a patient cope with arthritis is an example of tertiary prevention, which aims to help a patient deal with the residual consequences of a problem or to prevent the problem from recurring. Question 57. The nurse in charge is assessing a patient's abdomen. Which examination technique should the nurse use first? A. Auscultation. B. Inspection. C. Percussion. D. Palpation. Question 57. Answer: B. Inspection. Question 57. Explanation: inspection always comes first when performing a physical examination. Percussion and palpation of the abdomen may affect bowel motility and therefore should follow auscultation. Question 58. Which statement regarding heart sounds is correct? A. S1 and S2 sound equally loud over the entire cardiac area. B. S1 and S2 sound fainter at the apex. C. S1 and S2 sound fainter at the base. D. S1 is loudest at the apex, and S2 is loudest at the base. Question 58. Answer: D. S1 is loudest at the apex, and S2 is loudest at the base. Question 58. Explanation: the S1 sound, the lub sound, is loudest at the apex of the heart. It sounds longer, lower, and louder there than the S2 sounds. The S2, the dub sound, is loudest at the base. It sounds shorter, sharper, higher, and louder there than S1. Question 59. The nurse in charge identifies a patient's responses to actual or potential health problems during which step of the nursing process? A. Assessment. B. Nursing diagnosis. C. Planning. D. Evaluation. Question 59. Answer: B. Nursing diagnosis. Question 59. Explanation: the nurse identifies human responses to actual or potential health problems during the nursing diagnosis step of the nursing process. During the assessment step, the nurse systematically collects data about the patient or family. During the planning step, the nurse develops strategies to resolve or decrease the patient's problem. During the evaluation step, the nurse determines the effectiveness of the plan of care. Question 60. A female patient is receiving furosemide, Lasix, 40 mg POBID in the plan of care. The nurse should emphasize teaching the patient about the importance of consuming A. Fresh, green vegetables. B. Bananas and oranges. C. Lean red meat. D. Creamed corn. Question 60 Answer: B. Bananas and oranges. Question 60 Explanation: because furosemide is a potassium-wasting diuretic, the nurse should plan to teach the patient to increase intake of potassium-rich foods, such as bananas and oranges. Fresh, green vegetables, lean red meat, and creamed corn are not good sources of potassium. Question 61. The nurse in charge must monitor a patient receiving chloramphenicol for adverse drug reaction. What is the most toxic reaction to chloramphenicol? A. Lethal arrhythmias. B. Malignant hypertension. C. Status epilepticus. D. Bone marrow suppression. Question 61 Answer: D. Bone marrow suppression. Question 61 Explanation: the most toxic reaction to chloramphenicol is bone marrow suppression. Chloramphenicol is not known to cause lethal arrhythmias, malignant hypertension, or status epilepticus. Question 62. A female patient is diagnosed with deep vein thrombosis. Which nursing diagnosis should receive highest priority at this time? A. Impaired gas exchanges related to increased blood flow. B. Fluid volume excess related to peripheral vascular disease. C. Risk for injury related to edema. D. Altered peripheral tissue perfusion related to venous congestion. Question 62 Answer: D. Altered peripheral tissue perfusion related to venous congestion. Question 62 Explanation: altered peripheral tissue perfusion related to venous congestion takes highest priority because venous inflammation and clot formation impede blood flow in a patient with deep vein thrombosis. Option A is incorrect because impaired gas exchange is related to decreased, not increased, blood flow. Option B is inappropriate because no evidence suggests that this patient has a fluid volume excess. Option C may be warranted but is secondary to altered tissue perfusion. Question 63. When positioned properly, the tip of a central venous catheter should lie in the A. superior vena cava, B. basilica vein, C. jugular vein, D. subclavian vein. Question 63 Answer: a superior vena cava. Question 63 Explanation: when the central venous catheter is positioned correctly, its tip lies in the superior vena cava, inferior vena cava, or the right atrium, that is, in central venous circulation. Blood flows unimpeded around the tip, allowing the rapid infusion of large amounts of fluid directly into circulation. The basilica, jugular, and subclavian veins are common insertion sites for central venous catheters. Question 64. Nurse Nikki is revising a client's care plan. During which step of the nursing process does such revision take place? A. Assessment. B. Planning. C. Implementation. D. Evaluation. Question 64 Answer: D. Evaluation. Question 64 Explanation: during the evaluation step of the nursing process, the nurse determines whether the goals established in the care plan have been achieved, and evaluates the success of the plan. If a goal is unmet or partially met, the nurse re-examines the data and revises the plan. Assessment involves data collection. Planning involves setting priorities, establishing goals, and selecting appropriate interventions. Question 65. A 65-year-old female who has diabetes mellitus and has sustained a large laceration on her left wrist asks the nurse, "How long will it take for my scars to disappear?" Which statement would be the nurse's best response? A. The contraction phase of wound healing can take 2 to 3 years. B. Wound healing is very individual, but within 4 months the scar should fade. C. With your history and the type of location of the injury, it's hard to say. D. If you don't develop an infection, the wound should heal any time between 1 and 3 years from now. Question 65 Answer: C. With your history and the type of location of the injury, it's hard to say. Question 65 Explanation: wound healing in a client with diabetes will be delayed. Providing the client with a time frame could give the client false information. Question 66. One aspect of implementation related to drug therapy is A. Developing a content outline. B. Documenting drugs given. C. Establishing outcome criteria. D. Setting realistic client goals. Question 66 Answer: B. Documenting drugs given. Question 66 Explanation: although documentation isn't a step in the nursing process, the nurse is legally required to document activities related to drug therapy, including the time of administration, the quantity, and the client's reaction. Developing a content outline, establishing outcome criteria, and setting realistic client goals are part of planning rather than implementation. Question 67. A female client is readmitted to the facility with a warm, tender, reddened area on her right calf. Which contributing factor would the nurse recognize as most important? A. A history of increased aspirin use. B. Recent pelvic surgery. C. An active daily walking program. D. A history of diabetes. Question 67 Answer: B. Recent pelvic surgery. Question 67 Explanation: the client shows signs of deep vein thrombosis, DVT. The pelvic area is rich in blood supply, and thrombophlebitis of the deep vein is associated with pelvic surgery. Aspirin, an antiplatelet agent, and an active walking program help decrease the client's risk of DVT. In general, diabetes is a contributing factor associated with peripheral vascular disease. Question 68. Which intervention should the nurse in charge try first for a client that exhibits signs of sleep disturbance? A. Administer sleeping medication before bedtime. B. Ask the client each morning to describe the quantity of sleep during the previous night. C. Teach the client relaxation techniques, such as guided imagery, medication, and progressive muscle relaxation. D. Provide the client with normal sleep aids, such as pillows, back rubs, and snacks. Question 68 Answer: D. Provide the client with normal sleep aids, such as pillows, back rubs, and snacks. Question 68 Explanation: the nurse should begin with the simplest interventions, such as pillows or snacks, before interventions that require greater skill such as relaxation techniques. Sleep medication should be avoided whenever possible. At some point, the nurse should do a thorough sleep assessment, especially if common-sense interventions fail. Question 69. While examining a client's leg, the nurse notes an open ulceration with visible granulation tissue in the wound. Until a wound specialist can be contacted, which type of dressings is most appropriate for the nurse in charge to apply? A. Dry sterile dressing. B. Sterile petroleum gauze. C. Moist, sterile saline gauze. D. Povidone iodine-soaked gauze. Question 69 Answer: C. Moist, sterile saline gauze. Question 69 Explanation: moist, sterile saline dressings support wound heal and are cost-effective. Dry sterile dressings adhere to the wound and debride the tissue when removed. Petroleum supports healing but is expensive. Povidone iodine can irritate epithelial cells, so it shouldn't be left on an open wound. Question 70. A male client in a behavioral health facility receives a 30-minute psychotherapy session, and provider uses a current procedure terminology, CPT, code that bills for a 50-minute session. Under the False Claims Act, such illegal behavior is known as A. Unbundling. B. Overbilling. C. Upcoding. D. Misrepresentation. Question 70 Answer: C. Upcoding. Question 70 Explanation: upcoding is the practice of using a CPT code that's reimbursed at a higher rate than the code for the service actually provided. Unbundling, overbilling, and misrepresentation aren't the terms used for this illegal practice. Question 71. A nurse assigned to care for a postoperative male client who has diabetes mellitus. During the assessment interview, the client reports that he's impotent and says that he's concerned about its effect on his marriage. In planning this client's care, the most appropriate intervention would be to A. Encourage the client to ask questions about personal sexuality. B. Provide time for privacy. C. Provide support for the spouse or significant other. D. Suggest referral to a sex counselor or other appropriate professional. Question 71 Answer: D. Suggest referral to a sex counselor or other appropriate professional. Question 71 Explanation. The nurse should refer this client to a sex counselor or other professional. Making appropriate referrals is a valid part of planning the client's care. The nurse doesn't normally provide sex counseling. Therefore, providing time for privacy and providing support for the spouse or significant other are important, but not as important as referring the client to a sex counselor. Question 72. Using Abraham Maslow's hierarchy of human needs, a nurse assigns highest priority to which client need? A. Security. B. Elimination. C. Safety. D. Belonging. Question 72 Answer. B. Elimination. Question 72 Explanation. According to Maslow, elimination is a first-level or physiological need, and therefore takes priority over all other needs. Security and safety are second-level needs, belonging is a third-level need. Second and third-level needs can be met only after a client's first-level needs have been satisfied. Question 73. A male client is on prolonged bed rest, has developed a pressure ulcer. The wound shows no signs of healing even though the client has received skin care and has been turned every 2 hours. Which factor is most likely responsible for the failure to heal? A. Inadequate vitamin D intake. B. Inadequate protein intake. C. Inadequate massaging of the affected area. D. Low calcium level. Question 73 Answer. B. Inadequate protein intake. Question 73 Explanation. A client on bed rest suffers from a lack of movement and a negative nitrogen balance. Therefore, inadequate protein intake impairs wound healing. Inadequate vitamin D intake and low calcium levels aren't factors in poor healing for this client. A pressure ulcer should never be massaged. Question 74. A female client who received general anesthesia returns from surgery. Postoperatively, which nursing diagnosis takes highest priority for this client? A. Acute pain related to surgery. B. Deficient fluid volume related to blood and fluid loss from surgery. C. Impaired physical mobility related to surgery. D. Risk for aspiration related to anesthesia. Question 74 Answer. D. Risk for aspiration related to anesthesia. Question 74 Explanation. Risk for aspiration related to anesthesia takes priority for THIN's client because general anesthesia may impair the gag and swallowing reflexes, possibly leading to aspiration. The other options, although important, are secondary. Question 75. The nurse inspects a client's back and notices small hemorrhagic spots. The nurse documents that the client has A. Extravasation. B. Osteomalacia. C. Petechiae. D. Uremia. Question 75 Answer. C. Petechiae. Question 75 Explanation. Petechiae are small hemorrhagic spots. Extravasation is the leakage of fluid in the interstitial space. Osteomalacia is the softening of bone tissue. Uremia is an excess of urea and other nitrogen products in the blood. Question 76. Which document addresses the client's right to information, informed consent, and treatment refusal? A. Standard of Nursing Practice. B. Patient's Bill of Rights. C. Nurse Practice Act. D. Code for Nurses. Question 76 Answer. B. Patient's Bill of Rights. Question 76 Explanation. The Patient's Bill of Rights addresses the client's right to information, informed consent, timely responses to requests for services, and treatment refusal. A legal document, it serves as a guideline for the nurse's decision-making. Standards of Nursing Practice, the Nurse Practice Act, and the Code for Nurses contain nursing practice parameters and primarily describe the use of the nursing process in providing care. Question 77. If a blood pressure cuff is too small for a client, blood pressure readings taken with such a cuff may do which of the following? A. Fail to show changes in blood pressure. B. Produce a false high measurement. C. Cause sciatic nerve damage. D. Produce a false low measurement. Question 77 Answer. B. Produce a false high measurement. Question 77 Explanation. Using an undersized blood pressure cuff produces a falsely elevated blood pressure because the cuff can't record brachial artery measurements unless it's excessively inflated. The sciatic nerve wouldn't be damaged by hyperinflation of the blood pressure cuff because the sciatic nerve is located in the lower extremity. Question 78. Nurse Elijah has been teaching a client about a high-protein diet. The teaching is successful if the client identifies which meal is high in protein. A. Baked beans, hamburger, and milk. B. Spaghetti with cream sauce, broccoli, and tea. C. Bouillon, spinach, and soda. D. Chicken cutlet, spinach, and soda. Question 78. Answer: A. Baked beans, hamburger, and milk. Question 78. Explanation: Baked beans, hamburger, and milk are all excellent sources of protein. The spaghetti broccoli tea choice is high in carbohydrates. The bouillon spinach soda choice provides liquid and sodium as well as some iron, vitamins, and carbohydrates. Chicken provides protein, but the chicken spinach soda combination provides less protein than the baked beans hamburger milk selection. Question 79. A male client is admitted to the hospital with blunt chest trauma after a motor vehicle accident. The first nursing priority for this client would be to: A. Assess the client's airway. B. Provide pain relief. C. Encourage deep breathing and coughing. D. Splint the chest wall with a pillow. Question 79. Answer: Assess the client's airway. Question 79. Explanation: The first priority is to evaluate airway patency before assessing for signs of obstruction, sternal retraction, stutter, or wheezing. Airway management is always the nurse's first priority. Pain management and splinting are important for the client's comfort, but would come after airway assessment. Coughing and deep breathing may be contraindicated if the client has internal bleeding and other injuries. Question 80. A newly hired charge nurse assesses the staff nurses as competent individually but ineffective and non-productive as a team. In addressing her concern, the charge nurse should understand that the usual reason for such a situation is: A. Unhappiness about the charge in leadership. B. Unexpected feeling and emotions among the staff. C. Fatigue from overwork and understaffing. D. Failure to incorporate staff in decision-making. Question 80. Answer: B. Unexpected feeling and emotions among the staff. Question 80. Explanation: The usual or most prevalent reason for lack of productivity in a group of competent nurses is inadequate communication or a situation in which the nurses have unexpected feeling and emotions. Although the other options could be contributing to the problematic situation, they're less likely to be the cause. Question 81. A male client blood test results are as follows: white blood cell, WBC, count, 100 ul, hemoglobin, HB, level, 14 grams/dl, hematocrit, HCT, 40%. Which goal would be most important for this client? A. Promote fluid balance. B. Prevent infection. C. Promote rest. D. Prevent injury. Question 81. Answer: B. Prevent infection. Question 81. Explanation: The client is at risk for infection because WBC count is dangerously low. HB level and HCT are within normal limits, therefore, fluid balance, rest, and prevention of injury are inappropriate. Question 82. Following a tonsillectomy, a female client returns to the medical surgical unit. The client is lethargic and reports having a sore throat. Which position would be most therapeutic for this client? A. Semi-Fowlers. B. Supine. C. High Fowlers. D. Side lying. Question 82. Answer: D. Side lying. Question 82. Explanation: Because of lethargy, the post-tonsillectomy client is at risk for aspirating blood from the surgical wound. Therefore, placing the client in the side-lying position until he awake is best. The semi-Fowlers, supine, and high Fowlers position don't allow for adequate oral drainage in a lethargic post-tonsillectomy client, and increase the risk of blood aspiration. Question 83. The nurse inspects a client's pupil size and determines that it's 2 mm in the left eye and 3 mm in the right eye. Unequal pupils are known as A. Anisocoria, B. Ataxia, C. Cataract, D. Diplopia. Question 83 Answer: Anisocoria. Question 83 Explanation: Unequal pupils are called anisocoria. Ataxia is uncoordinated actions of involuntary muscle use. A cataract is an opacity of the eye's lens. Diplopia is double vision. Question 84. The nurse in charge is caring for an Italian client. He is complaining of pain, but he falls asleep right after his complaint and before the nurse can assess his pain. The nurse concludes that A. He may have a low threshold for pain. B. He was faking pain. C. Someone else gave him medication. D. The pain went away. Question 84 Answer: He may have a low threshold for pain. Question 84 Explanation: People of Italian heritage tend to verbalize discomfort and pain. The pain was real to the client, and he may need medication when he wakes up. Question 85. A female client is admitted to the emergency department with complaints of chest pain, shortness of breath. The nurse's assessment reveals jugular vein distension. The nurse knows that when a client has jugular vein distension, it's typically due to A. a neck tumor, B. an electrolyte imbalance, C. dehydration, D. fluid overload. Question 85 Answer: D. fluid overload. Question 85 Explanation: Fluid overload causes the volume of blood within the vascular system to increase. This increase causes the vein to distend, which can be seen most obviously in the neck veins. A neck tumor doesn't typically cause jugular vein distension. An electrolyte imbalance may result in fluid overload, but it doesn't directly contribute to jugular vein distension. Question 86. Critical thinking and the nursing process have which of the following in common? Both A. are important to use in nursing practice. B. use an ordered series of steps. C. are patient-specific processes. D. were developed specifically for nursing. Question 86 Answer: are important to use in nursing practice. Question 86 Explanation: Nurses make many decisions, some require using the nursing process, whereas others are not client-related but require critical thinking. The nursing process has specific steps, critical thinking does not. Neither is linear. Critical thinking applies to any discipline. Question 87. In which step of the nursing process does the nurse analyze data and identify client problems? A. Assessment. B. Diagnosis. C. Planning outcomes. D. Evaluation. Question 87 Answer: B. Diagnosis. Question 87 Explanation: In the assessment phase, the nurse gathers data from many sources for analysis in the diagnosis phase. In the diagnosis phase, the nurse identifies the client's health status. In the planning outcomes phase, the nurse formulates goals and outcomes. In the evaluation phase, which occurs implementing interventions, the nurse gathers data about the client's responses to nursing care to determine whether client outcomes were met. Question 88. In which phase of the nursing process does the nurse decide whether her actions have successfully treated the client's health problem? A. Assessment. B. Diagnosis. C. Planning outcomes. D. Evaluation. Question 88 Answer: D. Evaluation. Question 88 Explanation: In the assessment phase, the nurse gathers data from many sources for analysis in the diagnosis phase. In the diagnosis phase, the nurse identifies the client's health status. In the planning outcomes phase, the nurse and client decide on goals they want to achieve. In the intervention planning phase, the nurse identifies specific interventions to help achieve the identified goal. During the implementation phase, the nurse carries out the interventions or delegates them to other healthcare team members. During the evaluation phase, the nurse judges whether her actions have been successful in treating or preventing the identified client health problem. Question 89. What is the most basic reason that self-knowledge is important for nurses? Because it helps the nurse to A. identify personal biases that may affect his thinking and actions. B. Identify the most effective interventions for a patient. C. Communicate more efficiently with colleagues, patients, and families. D. Learn and remember new procedures and techniques. Question 89 Answer. Identify personal biases that may affect his thinking and actions. Question 89 Explanation. The most basic reason is that self-knowledge directly affects the nurse's thinking and the actions he chooses. Indirectly, thinking is involved in identifying effective interventions, communicating, and learning procedures. However, because identifying personal biases affects all the other nursing actions, it is the most basic reason. Question 90. Arrange the steps of the nursing process in the sequence in which they generally occur. A. Assessment. B. Evaluation. C. Planning outcomes. D. Planning intervention. Z. Diagnosis. A. E. B. A. D. C. B. A. B. C. D. E. C. A. E. C. D. B. D. D. A. B. E. C. Question 90 Answer. C. A. E. C. D. B. Question 90 Explanation. Logically, the steps are assessment, diagnosis, planning outcomes, planning interventions, and evaluation. Keep in mind that steps are not always performed in this order, depending on the patient's needs, and that steps overlap. Question 91. How are critical thinking skills and critical thinking attitudes similar? Both are. A. Influences on the nurse's problem-solving and decision-making. B. Like feelings rather than cognitive activities. C. Cognitive activities rather than feelings. D. Applicable in all aspects of a person's life. Question 91 Answer. A. Influences on the nurse's problem-solving and decision-making. Question 91 Explanation. Cognitive skills are used in complex thinking processes, such as problem-solving and decision-making. Critical thinking attitudes determine how a person uses her cognitive skills. Critical thinking attitudes are traits of the mind, such as independent thinking, intellectual curiosity, intellectual humility, and fair-mindedness, to name a few. Critical thinking skills refer to the cognitive activities used in complex thinking processes. A few examples of these skills involve recognizing the need for more information, recognizing gaps in one's own knowledge, and separating relevant from irrelevant data. Critical thinking, which consists of intellectual skills and attitudes, can be used in all aspects of life. Question 92. The nurse is preparing to admit a patient from the emergency department. The transferring nurse reports that the patient with chronic lung disease has a 30-plus year history of tobacco use. The nurse used to smoke a pack of cigarettes a day at one time and worked very hard to quit smoking. She immediately thinks to herself, I know I tend to feel negatively about people who use tobacco, especially when they have a serious lung condition. I figure if I can stop smoking, they should be able to. I must remember how physically and psychologically difficult that is, and be very careful not to be judgmental of this patient. This best illustrates A. Theoretical knowledge. B. Self-knowledge. C. Using reliable resources. D. Use of the nursing process. Question 92 Answer. B. Self-knowledge. Question 92 Explanation. Personal knowledge is self-understanding, awareness of one's beliefs, values, biases, and so on. That best describes the nurse's awareness that her bias can affect her patient care. Theoretical knowledge consists of information, facts, principles, and theories in nursing and related disciplines. It consists of research findings and rationally constructed explanations of phenomena. Using reliable resources is a critical thinking skill. The nursing process is a problem-solving process consisting of the steps of assessing, diagnosing, planning outcomes, planning interventions, implementing, and evaluating. The nurse has not yet met this patient, so she could not have begun the nursing process. Question 93. Which organization's standards require that all patients be assessed specifically for pain? A. American Nurses Association, ANA. B. State Nurse Practice Acts. C. National Council of State Boards of Nursing, NCSBN. D. The Joint Commission. Question 93 Answer. D. The Joint Commission. Question 93 Explanation. The Joint Commission has developed assessment standards, including that all clients be assessed for pain. The ANA has developed standards for clinical practice, including those for assessment, but not specifically for pain. State Nurse Practice Acts regulate nursing practice in individual states. The NCSBN asserts that the scope of nursing includes a comprehensive assessment but does not specifically include pain. Question 94. Which of the following is an example of data that should be validated? A. The urinalysis report indicates there are white blood cells in the urine. B. The client states she feels feverish. You measure the oral temperature at 98 degrees Fahrenheit. C. The client has clear breath sounds. You count a respiratory rate of 18. D. The chest X-ray report indicates the client has pneumonia in the right lower lobe. Question 94 Answer. B. The client states she feels feverish. You measure the oral temperature at 98 degrees Fahrenheit. Question 94 Explanation. Validation should be done when subjective and objective data do not make sense. For instance, it is inconsistent data when the patient feels feverish and you obtain a normal temperature. The other distractors do not offer conflicting data. Validation is not usually necessary for laboratory test results. Question 95. Which of the following is an example of appropriate behavior when conducting a client interview? A. Recording all the information on the agency-approved form during the interview. B. Asking the client, why did you think it was necessary to seek health care at this time? C. Using precise medical terminology when asking the client questions. D. Sitting, facing the client in a chair at the client's bedside, using active listening. Question 95 Answer. D. Sitting, facing the client in a chair at the client's bedside, using active listening. Question 95 Explanation. Active listening should be used during an interview. The nurse should face the patient, have relaxed posture, and keep eye contact. Asking why may make the client defensive. Note-taking interferes with eye contact. The client may not understand medical terminology or healthcare jargon. Question 96. The nurse wishes to identify nursing diagnoses for a patient. She can best do this by using a data collection form organized according to, select all that apply. A. A body systems model. B. A head-to-toe framework. C. Maslow's hierarchy of needs. D. Gordon's functional health patterns. Question 96 Answer. C. Maslow's hierarchy of needs. D. Gordon's functional health patterns. Question 96 Explanation. Nursing models produce a holistic database that is useful in identifying nursing rather than medical diagnoses. Body systems and head-to-toe are not nursing models, and they are not holistic. They focus on identifying physiological needs or disease. Maslow's hierarchy is not a nursing model, but it is holistic, so it is acceptable for identifying nursing diagnoses. Gordon's functional health patterns are a nursing model. Question 97. The nurse is recording assessment data. She writes, the patient seems worried about his surgery. Other than that, he had a good night. Which errors did the nurse make? Select all that apply. A. Used a vague generality. B. Did not use the patient's exact words. C. Used a waffle word, for example, appears. D. Recorded an inference rather than a cue. Question 97 Answer. A. Used a vague generality. C. Used a waffle word, for example, appears. D. Recorded an inference rather than a cue. Question 97 Explanation. The nurse recorded a vague generality, he has had a good night. The nurse did not use the patient's exact words, but she did not quote the patient at all, so that is not one of her errors. The nurse used the waffle word, seems worried, instead of documenting what the patient said or did to lead her to that conclusion. The nurse recorded these inferences, worried and had a good night. Question 98. A patient is admitted with shortness of breath, so the nurse immediately listens to his breath sounds. Which type of assessment is the nurse performing? A. Ongoing assessment. B. Comprehensive physical assessment. C. Focused physical assessment. D. Psychosocial assessment. Question 98 answer. C. Focused physical assessment. Question 98 explanation. The nurse is performing a focused physical assessment, which is done to obtain data about an identified problem, in this case shortness of breath. An ongoing assessment is performed as needed, after the initial data are collected, preferably with each patient contact. A comprehensive physical assessment includes an interview and a complete examination of each body system. A psychosocial assessment examines both psychological and social factors affecting the patient. The nurse conducting a psychosocial assessment would gather information about stressors, lifestyle, emotional health, social influences, coping patterns, communication, and personal responses to health and illness, to name a few aspects. Question 99. The nurse is assessing vital signs for a patient just admitted to the hospital. Ideally, and if there are no contraindications, how should the nurse position the patient for this portion of the admission assessment? A. Sitting upright. B. Lying flat on the back with knees flexed. C. Lying flat on the back with arms and legs fully extended. D. Side lying with the knees flexed. Question 99 answer. A sitting upright. Question 99 explanation. If the patient is able, the nurse should have the patient sit upright to obtain vital signs in order to allow the nurse to easily access the anterior and posterior chest for auscultation of heart and breath sounds. It allows for full lung expansion and is the preferred position for measuring blood pressure. Additionally, patients might be more comfortable and feel less vulnerable when sitting upright, rather than lying down on the back, and can have direct eye contact with the examiner. However, other positions can be suitable when the patient's physical condition restricts the comfort or ability of the patient to sit upright. Question 100. For all body systems except the abdomen, what is the preferred order for the nurse to perform the following examination techniques? A. Palpation. B. Auscultation. C. Inspection. D. Percussion. A. D. B. A. C. B. C. A. D. B. C. B. C. D. A. D. A. B. C. D. Question 100 answer. B. C. A. D. B. Question 100 explanation. Inspection begins immediately as the nurse meets the patient, as she observes the patient's appearance and behavior. Observational data are not intrusive to the patient. When performing assessment techniques involving physical touch, the behavior, posture, demeanor, and responses might be altered. Palpation, percussion, and auscultation should be performed in that order, except when performing an abdominal assessment. During abdominal assessment, auscultation should be performed before palpation and percussion to prevent altering bowel sounds. Question 101. The nurse is assessing a patient admitted to the hospital with rectal bleeding. The patient had a hip replacement 2 weeks ago. Which position should the nurse avoid when examining this patient's rectal area? A. Sims. B. Supine. C. Dorsal recumbent. D. Semi-Fowlers. Question 101 answer. A Sims. Question 101 explanation. Sims position is typically used to examine the rectal area. However, the position should be avoided if the patient has undergone hip replacement surgery. The patient with a hip replacement can assume the supine, dorsal recumbent, or semi-Fowlers positions without causing harm to the joint. Supine position is lying on the back facing upward. The patient in dorsal recumbent is on his back with knees flexed and soles of feet flat on the bed. In semi-Fowlers position, the patient is supine with the head of the bed elevated and legs slightly elevated. Question 102. How should the nurse modify the examination for a 7-year-old child? A. Ask the parents to leave the room before the examination. B. Demonstrate equipment before using it. C. Allow the child to help with the examination. D. Perform invasive procedures, for example, otoscopic, last. Question 102 answer. B. Demonstrate equipment before using it. Question 102 explanation. The nurse should modify his examination by demonstrating equipment before using it to examine a school-age child. The nurse should make sure parents are not present during the physical examination of an adolescent, but they usually help younger children feel more secure. The nurse should allow a preschooler to help with the examination when possible, but not usually a school-age child. Toddlers are often fearful of invasive procedures, so those should be performed last in this age group. It is best to perform invasive procedures last for all age groups, therefore, this does not represent a modification. Question 103. The nurse must examine a patient who is weak and unable to sit unaided or to get out of bed. How should she position the patient to begin and perform most of the physical examination? A. Dorsal recumbent. B. Semifowlers. C. Lithotomy. D. Sims. Question 103. Answer: B. Semifowlers. Question 103. Explanation: if a patient is unable to sit up, the nurse should place him lying flat on his back, with the head of the bed elevated. Dorsal recumbent position is used for abdominal assessment if the patient has abdominal or pelvic pain. The patient in dorsal recumbent is on his back with knees flexed and soles of feet flat on the bed. Lithotomy position is used for female pelvic examination. It is similar to dorsal recumbent position, except that the patient's legs are well separated and thighs are acutely flexed. Feet are usually placed in stirrups. Fold sheet or bath blanket crosswise over thighs and legs so that genital area is easily exposed. Keep patient covered as much as possible. The patient in Sims position is on left side with right knee flexed against abdomen and left knee slightly flexed. Left arm is behind body, right arm is placed comfortably. Sims position is used to examine the rectal area. In Semifowlers position, the patient is supine with the head of the bed elevated and legs slightly elevated. Question 104. The nurse should use the diaphragm of the stethoscope to auscultate which of the following? A. Heart murmurs. B. Jugular venous hums. C. Bowel sounds. D. Carotid bruits. Question 104. Answer: C. Bowel sounds. Question 104. Explanation: the bell of the stethoscope should be used to hear low-pitched sounds, such as murmurs, bruits, and jugular hums. The diaphragm should be used to hear high-pitched sounds that normally occur in the heart, lungs, and abdomen. Question 105. The nurse calculates a body mass index, BMI, of 18 for a young adult woman who comes to the physician's office for a college physical. This patient is considered A. Obese. B. Overweight. C. Average. D. Underweight. Question 105. Answer: D. Underweight. Question 105. Explanation: for adults, BMI should range between 105 and 25. BMI less than 105 is considered underweight, BMI 25 to 29.9 is overweight, and BMI greater than 30 is considered obese. Question 106. The charge nurse asks the nursing assistive personnel, NAP, to give a bag bath to a patient with end-stage chronic obstructive pulmonary disease. How should the NAP proceed? A. Bathe the patient's entire body using 8 to 10 washcloths. B. Assist the patient to a chair and provide bathing supplies. C. Saturate a towel and blanket in a plastic bag, and then bathe the patient. D. Assist the patient to the bathtub and provide a bath chair. Question 106. Answer: A. Bathe the patient's entire body using 8 to 10 washcloths. Question 106. Explanation: a towel bath is a modification of the bed bath in which the NAP places a large towel and a bath blanket into a plastic bag, saturates them with a commercially prepared mixture of moisturizer, non-rinse cleaning agent, and water, warms them in a microwave, and then uses them to bathe the patient. A bag bath is a modification of the towel bath, in which the NAP uses 8 to 1060 washcloths instead of a towel or blanket. Each part of the patient's body is bathed with a fresh cloth. A bag bath is not given in a chair or in the tub. Question 107. For a morbidly obese patient, Which intervention should the nurse choose to counteract the pressure created by the skin folds? A. Cover the mattress with a sheepskin. B. Keep the linens wrinkle-free. C. Separate the skin folds with towels. D. Apply petrolatum barrier creams. Question 107. Answer: B. Keep the linens wrinkle-free. Question 107. Explanation: separating the skin folds with towels relieves the pressure of skin rubbing on skin. Sheepskins are not recommended for use at all. Petrolatum barrier creams are used to minimize moisture caused by incontinence. Question 108. A client exhibits all of the following during a physical assessment. Which of these is considered a primary defense against infection? A. Fever. B. Intact skin. C. Inflammation. D. Lethargy. Question 108. Answer: B. Intact skin. Question 108. Explanation: intact skin is considered a primary defense against infection. Fever, the inflammatory response, and phagocytosis, a process of killing pathogens, are considered secondary defenses against infection. Question 109. A client with a stage 2 pressure ulcer has methicillin-resistant Staphylococcus aureus, MRSA, cultured from the wound. Contact precautions are initiated. Which rule must be observed to follow contact precautions? A. A clean gown and gloves must be worn when in contact with the client. B. Everyone who enters the room must wear a N95 respirator mask. C. All linen and trash must be marked as contaminated and sent to biohazard waste. D. Place the client in a room with a client with an upper respiratory infection. Question 109. Answer: a clean gown and gloves must be worn when in contact with the client. Question 109. Explanation: a clean gown and gloves must be worn when any contact is anticipated with the client or with contaminated items in the room. A respirator mask is required only with airborne precautions, not contact precautions. All linen must be double-bagged and clearly marked as contaminated. The client should be placed in a private room or in a room with a client with an active infection caused by the same organism and no other infections. Question 110. A client requires protective isolation. Which client can be safely paired with this client in a client care assignment? 1. A. Admitted with unstable diabetes mellitus. B. Who underwent surgical repair of a perforated bowel. C. With a stage 3 sacral pressure ulcer. D. Admitted with a urinary tract infection. Question 110. Answer: admitted with unstable diabetes mellitus. Question 110. Explanation: the client with unstable diabetes mellitus can safely be paired in a client care assignment because the client is free from infection. Perforation of the bowel exposes the client to infection requiring antibiotic therapy during the postoperative period. Therefore, this client should not be paired with a client in protective isolation. A client in protective isolation should not be paired with a client who has an open wound, such as a stage 3 pressure ulcer, or with a client who has a urinary tract infection. Question 111. A newly hired at Nurses Labs Medical Center is assigned in the OR department. Which action demonstrates a break-in sterile technique? A. Remaining 1 foot away from non-sterile areas. B. Placing sterile items on the sterile field. C. Avoiding the border of the sterile drape. D. Reaching 1 foot over the sterile field. Question 111. Answer: D. Reaching 1 foot over the sterile field. Question 111. Explanation: reaching over the sterile field while wearing sterile garb breaks sterile technique. While observing sterile technique, healthcare workers should remain 1 foot away from non-sterile areas while wearing sterile garb, place sterile items needed for the procedure on the sterile drape, and avoid coming in contact with the 1-inch border of the sterile drape. Question 112. Nurse Berta is facilitating a monthly mother's class at a small village. As a knowledgeable nurse, she must know that a mother who breastfeeds her child passes on which antibody through breast milk? A. IG. B. IG. E. C. IG. G. D. M. Question 112 Answer, C. Ig. Question 112 Explanation. The antibody Ig is passed to the child through the mother's breast milk during breastfeeding. Ig, and Im are produced by the child's body after exposure to an antigen. Question 113. The clinical instructor asks her students the rationale for hand washing. The students are correct if they answered that hand washing is expected to remove A. Transient flora from the skin. B. Resident flora from the skin. C. All microorganisms from the skin. D. Media for bacterial growth. Question 113 Answer, a transient flora from the skin. Question 113 Explanation. There are two types of normal flora, transient and resident. Transient flora are normal flora that a person picks up by coming in contact with objects or another person, for example, when you touch a soiled dressing. You can remove these with hand washing. Resident flora live deep in skin layers where they live and multiply harmlessly. They are permanent inhabitants of the skin and cannot usually be removed with routine hand washing. Removing all microorganisms from the skin, sterilization, is not possible without damaging the skin tissues. To live and thrive in humans, microbes must be able to use the body's precise balance of food, moisture, nutrients, electrolytes, pH, temperature, and light. Food, water, and soil that provide these conditions may serve as non-living reservoirs. Hand washing does little to make the skin uninhabitable for microorganisms, except perhaps briefly when an antiseptic agent is used for cleansing. Question 114. Which of the following incidents requires the nurse to complete an occurrence report? A. Medication given 30 minutes after scheduled dose time. B. Patient's dentures lost after transfer. C. Worn electrical cord discovered on an 4 infusion pump. D. Prescription without the route of administration. Question 114 Answer, B. Patient's dentures lost after transfer. Question 114 Explanation. You would need to complete an occurrence report if you suspect your patient's personal items to be lost or stolen. A medication can be administered within a half hour of the administration time without an error in administration, therefore, an occurrence report is not necessary. The worn electrical cord should be taken out of use and reported to the biomedical department. The nurse should seek clarification if the provider's order is missing information. An occurrence report is not necessary. Question 115. The nurse is orienting a new nurse to the unit and reviews source-oriented charting. Which statement by the nurse best describes source-oriented charting? Source-oriented charting. A. Separates the health record according to discipline. B. Organizes documentation around the patient's problems. C. Highlights the patient's concerns, problems, and strengths. D. Is designed to streamline documentation. Question 115 Answer, A. Separates the health record according to discipline. Question 115 Explanation. In source-oriented charting, each discipline documents findings in a separately labeled section of the chart. Problem-oriented charting organizes notes around the patient's problems. Focused charting highlights the patient's concerns, problems, and strengths. Charting by exception is a unique charting system designed to streamline documentation. Question 116. When the nurse completes the patient's admission nursing database, the patient reports that he does not have any allergies. Which acceptable medical abbreviation can the nurse use to document this finding? A. NA. B. NDA. C. NKA. D. NPO. Question 116 Answer, C. NKA. Question 116 Explanation. The nurse can use the medical abbreviation NKA, which means no known allergies, to document this finding. NA is an abbreviation for not applicable. NDA is an abbreviation for no known drug allergies. NPO is an abbreviation that means nothing by mouth. Question 117. The nurse is working on a unit that uses nursing assessment flow sheets. Which statement best describes this form of charting? Nursing assessment flow sheets. A are comprehensive charting forms that integrate assessments and nursing actions. B contain only graphic information, such as I&O, vital signs, and medication administration. C are used to record routine aspects of care, they do not contain assessment data. D contain vital data collected upon admission, which can be compared with newly collected data. Question 117 Answer: Are comprehensive charting forms that integrate assessments and nursing actions. Question 117 Explanation: Nursing assessment flow sheets are organized by body systems. The nurse checks the box corresponding to the current assessment findings. Nursing actions, such as wound care, treatments, or for fluid administration, are also included. Graphic information, such as vital signs, I&O, and routine care, may be found on the graphic record. The admission form contains baseline information. Question 118. At the end of the shift, the nurse realizes that she forgot to document a dressing change that she performed for a patient. Which action should the nurse take? A. Complete an occurrence report before leaving. B. Do nothing. The next nurse will document it was done. C. Write the note of the dressing change into an earlier note. D. Make a late entry as an addition to the narrative notes. Question 118 Answer: D. Make a late entry as an addition to the narrative notes. Question 118 Explanation: If the nurse fails to make an important entry while charting, she should make a late entry as an addition to the narrative notes. An occurrence report is not necessary in this case. If documentation is omitted, there is no legal verification that the procedure was performed. It is illegal to add to a chart entry that was previously documented. The nurse can only document care directly performed or observed. Therefore, the nurse on the incoming shift would not record the wound change as performed. Question 119. Patient Z asks Nurse Tony why an electronic health record (EHR) system is being used. Which response by the nurse indicates an understanding of the rationale for an EHR system? It includes organizational reports of unusual occurrences that are not part of the client's record. B. This type of system consists of combined documentation and daily care plans. C. It improves interdisciplinary collaboration that improves efficiency in procedures. D. This type of system tracks medication administration and usage over 24 hours. Question 119 Answer: C. It improves interdisciplinary collaboration that improves efficiency in procedures. Question 119 Explanation: The EHR has several benefits for use, including improving interdisciplinary collaboration and making procedures more accurate and efficient. An occurrence report is an organizational record of an unusual occurrence or accident that is not a part of the client's record. Integrated plans of care, IPOC, are a combined charting and care plan format. A medication administration record, MAR, is used to document medications administered and their usage. Question 120. In the United States, the first programs for training nurses were affiliated with A. the military, B. general hospitals, C. civil service, D. religious orders. Question 120 Answer: D. religious orders. Question 120 Explanation: When the Civil War broke out, the Army used nurses who had already been trained in religious orders. Although the Army did provide some training, it occurred later than in the religious orders. Although nurses were trained in hospitals, the training and the hospitals were affiliated with religious orders. Civil service was not mentioned in Chapter 1 and was not a factor in the early 1800s. Nursing started with religious orders. The Hindu faith was the first to write about nursing. In the United States, all training for nurses was affiliated with religious orders until after the Civil War. Question 121. Which of the following are an examples of a health restoration activity? Select all that apply. A. Administering an antibiotic every day. B. Teaching the importance of hand washing. C. Assessing a client's surgical incision. D. Advising a woman to get an annual mammogram after age 50 years. Question 121. Answer: administering an antibiotic every day. C. Assessing a client's surgical incision. Question 121. Explanation: health restoration activities help an ill client return to health. This would include taking an antibiotic every day and assessing a client's surgical incision. Hand washing and mammograms both involve healthy people who are trying to prevent illness. Question 122. Which of the following aspects of nursing is essential to defining it as both a profession and a discipline? A. Established standards of care. B. Professional organizations. C. Practice supported by scientific research. D. Activities determined by a scope of practice. Question 122. Answer: C. Practice supported by scientific research. Question 122. Explanation: the American Nurses Association, ANA, has developed standards of care, but they are unrelated to defining nursing as a profession or discipline. Having professional organizations is not included in accepted characteristics of either a profession or a discipline. A profession must have knowledge that is based on technical and scientific knowledge. The theoretical knowledge of a discipline must be based on research, so both are scientifically based. Having a scope of practice is not included in accepted characteristics of either a profession or a discipline. Question 123. The charge nurse on the medical surgical floor assigns vital signs to the nursing assistive personnel, NAP, and medication administration to the licensed vocational nurse, LVN. Which nursing model of care is this floor following? A. Team nursing. B. Case method nursing. C. Functional nursing. D. Primary nursing. Question 123. Answer: C. Functional nursing. Question 123. Explanation: with team nursing, an RN or LVN is paired with an AP. The pair is then assigned to render care for a group of patients. In case method nursing, one nurse cares for one patient during her entire shift. Private duty nursing is an example of this care model. This medical surgical floor is following the functional nursing model of care, in which care is partitioned and assigned to a staff member with the appropriate skills. For example, the NAP is assigned vital signs, and the LVN is assigned medication administration. When the primary nursing model is utilized, one nurse manages care for a group of patients 24 hours a day, even though others provide care during part of the day. Question 124. Paul Jack suffered a stroke and has difficulty swallowing. Which healthcare team member should be consulted to assess the patient's risk for aspiration? A. Respiratory therapist. B. Occupational therapist. C. Dentist. D. Speech therapist. Question 124. Answer: D. Speech therapist. Question 124. Explanation: respiratory therapists provide care for patients with respiratory disorders. Occupational therapists help patients regain function and independence. Dentists diagnose and treat dental disorders. Speech and language therapists provide assistance to clients experiencing swallowing and speech disturbances. They assess the risk for aspiration and recommend a treatment plan to reduce the risk. Question 125. Which of the following are an examples of theoretical knowledge? Select all that apply. A. Antibiotics are ineffective in treating viral infections. B. When you take a patient's blood pressure, the patient's arm should be at heart level. C. In Maslow's framework, physical needs are most basic. D. When drawing medication out of a vial, inject air into the vial first. Question 125. Answer: antibiotics are ineffective in treating viral infections. C. In Maslow's framework, physical needs are most basic. Question 125. Explanation: theoretical knowledge consists of research findings, facts. For example, antibiotics are ineffective is a fact, principles, and theories. For example, in Maslow's framework is a statement from a theory. Instructions for taking a blood pressure and withdrawing medications are examples of practical knowledge, what to do and how to do it. Question 126. The nurse recognizes that urinary elimination changes may occur even in healthy older adults because of which of the following? A. The bladder distends and its capacity increases. B. Older adults ignore the need to void. C. Urine becomes more concentrated. D. The amount of urine retained after voiding increases. Question 126. Answer: D. The amount of urine retained after voiding increases. Question 126. Explanation: the capacity of the bladder may decrease with age, but the muscle is weaker and can cause urine to be retained. Option 4. Older adults don't ignore the urge to void and may have difficulty getting to the toilet in time. Option 2. The kidney becomes less able to concentrate urine with age. Option 3. Question 127. During assessment of the client with urinary incontinence, the nurse is most likely to assess for which of the following? Select all that apply. A. Perineal skin irritation. B. Fluid intake of less than 1,500 ml/d. C. History of antihistamine intake. D. 8 checks of UTI. E. A fecal impaction. Question 127. Answer: a perineal skin irritation. B. Fluid intake of less than 1,500 ml/d. D. 8 checks of UTI. E. A fecal impaction. Question 127. Explanation: the perineum may become irritated by the frequent contact with urine. Opt 1. Normal fluid intake is at least 1,500 ml/d and clients often decrease their intake to try to minimize urine leakage. Opt. 127. UTIs can contribute to incontinence. Opt 4. A fecal impaction can compress the urethra, which results in small amounts of urine leakage. Opt. 5. Antihistamines can cause urinary retention rather than urinary incontinence. Opt. 3. Question 128. Which action represents the appropriate nursing management of a client wearing a condom catheter? A. Ensure that the tip of the penis fits snugly against the end of the condom. B. Check the penis for adequate circulation 30 minutes after applying. C. Change the condom every 8 hours. D. Tape the collecting tube to the lower abdomen. Question 128. Answer: B. Check the penis for adequate circulation 30 minutes after applying. Question 128. Explanation: the penis and condom should be checked 1/2 hour after application to ensure that it's not too tight. A 1-inch space should be left between the penis and the end of the condom. Opt 1. The condom is changed every 24 hours. Opt 128. And the tubing is taped to the leg or attached to a leg bag. An indwelling catheter is taped to the lower abdomen or upper thigh. Opt 4. Question 129. The catheter slips into the vagina during a straight catheterization of a female client. The nurse does which action? A. Leaves the catheter in place and gets a new sterile catheter. B. Leaves the catheter in place and asks another nurse to attempt the procedure. C. Removes the catheter and redirects it to the urinary meatus. D. Removes the catheter, wipes it with a sterile gauze, and redirects it to the urinary meatus. Question 129. Answer: A. Leaves the catheter in place and gets a new sterile catheter. Question 129. Explanation: the catheter in the vagina is contaminated and can't be reused. If left in place, it may help avoid mistaking the vaginal opening for the urinary meatus. A single failure to catheterize the meatus doesn't indicate that another nurse is needed, although sometimes a second nurse can assist in visualization of the meatus. Opt 2. Question 130. Which statement indicates a need for further teaching of a home care client with a long-term indwelling catheter? A. I will keep the collecting bag below the level of the bladder at all times. B. Intake of cranberry juice may help decrease the risk of infection. C. Soaking in a warm tub bath may ease the irritation associated with the catheter. D. I should use Clean Tech when emptying the collecting bag. Question 130. Answer: C. Soaking in a warm tub bath may ease the irritation associated with the catheter. Question 130. Explanation: soaking in a bathtub can increase the risk of exposure to bacteria. The bag should be below the level of the bladder to promote proper drainage. Opt 1. Intake of cranberry juice creates an environment non-conducive to infection. Opt 2. Clean technique is appropriate for touching the exterior portions of the system. Opt 4. Question 131. During shift report, the nurse learns that an older female client is unable to maintain continence after she senses the urge to void and becomes incontinent on the way to the bathroom. Which nursing diagnosis is most appropriate? A. Stress urinary incontinence. B. Reflex urinary incontinence. C. Functional urinary incontinence. D. Urge urinary incontinence. Question 131. Answer: D. Urge urinary incontinence. Question 131. Explanation: the key phrase is the urge to void. Option 1 occurs when the client coughs, sneezes, or jars the body, resulting in accidental loss of urine. Option 2 occurs with involuntary loss of urine at somewhat predictable intervals when a specific bladder volume is reached. Option 3 is involuntary loss of urine related to impaired function. Question 132. A female client has a urinary tract infection. Which teaching points by the nurse should be helpful to the client? Select all that apply. A. Limit fluids to avoid the burning sensation on urination. B. Review symptoms of UTI with the client. C. Wipe the perineal area from back to front. D. Wear cotton underclothes. E. Take baths rather than showers. Question 132. Answer: B. Review symptoms of UTI with the client. D. Wear cotton underclothes. Question 132. Explanation: Option 2 validates the diagnosis. Cotton underwear promotes appropriate exposure to air, resulting in decreased bacterial growth. Opt 4. Increased fluids decrease concentration and irritation. Opt 1. The client should wipe the perineal area from front to back to prevent spread of bacteria from the rectal area to the urethra. Opt 3. Showers reduce exposure of area to bacteria. Opt 5. Question 133. The nurse will need to assess the client's performance of clean intermittent self-catheterization, CISC, for a client with which urinary diversion? A. Ileal conduit. B. Cock pouch. C. Neobladder. D. Vesicostomy. Question 133. Answer: B. Cock pouch. Question 133. Explanation: the ileal conduit and vesicostomy, Opt 1,4, are incontinent urinary diversions, and clients are required to use an external ostomy appliance to contain the urine. Clients with a neobladder can control their voiding. Opt 3. Question 134. Which focus is the nurse most likely to teach for a client with a flaccid bladder? A. Habit training, attempt voiding at specific time periods. B. Bladder training, delay voiding according to a pre-scheduled timetable. C. Creed's maneuver, apply gentle manual pressure to the lower abdomen. D. Kegel exercises, contract the pelvic muscles. Question 134. Answer: C. Creed's maneuver, apply gentle manual pressure to the lower abdomen. Question 134. Explanation: because the bladder muscles will not contract to increase the intra-bladder pressure to promote urination, the process is initiated manually. Options 1, 2, and 4, to promote continence. Bladder contractions are required for habit training, bladder training, and increasing the tone of the pelvic muscles. Question 135. Which of the following behaviors indicates that the client on a bladder training program has met the expected outcomes? Select all that apply. A. Voids each time there is an urge. B. Practices slow, deep breathing until the urge decreases. C. Uses adult diapers, for just in case. D. Drinks citrus juices and carbonated beverages. E. Performs pelvic muscle exercises. Question 135. Answer: B. Practices slow, deep breathing until the urge decreases. E. Performs pelvic muscle exercises. Question 135. Explanation: it is important for the client to inhibit the urge to void sensation when a premature urge is experienced. Some clients may need diapers. This is not the best indicator of a successful program. Opt 3. Citrus juices may irritate the bladder. Opt 4. Carbonated beverages increase diuresis and the risk of incontinence. Opt for. Question 136. A nurse has identified that the patient has overflow incontinence. What is a major factor that contributes to this clinical manifestation? A. Coughing. B. Mobility deficits. C. Prostate enlargement. D. Urinary tract infection. Question 136. Answer: C. Prostate enlargement. Question 136. Explanation: an enlarged prostate compresses the urethra and interferes with the outflow of urine, resulting in urinary retention. With urinary retention, the pressure within the bladder builds until the external urethral sphincter temporarily opens to allow a small volume, 25 to 60 milliliters, of urine to escape. Overflow incontinence. Coughing, which raises the intra-abdominal pressure, is related to stress incontinence, not overflow incontinence. Opt 1. Mobility deficits, such as spinal cord injuries, are related to reflex incontinence, not overflow incontinence. Opt 2. Urinary tract infections are related to urge incontinence, not overflow incontinence. Opt 4. Question 137. A nurse must measure the intake and output, I&O, for a patient who has a urinary retention catheter. Which equipment is most appropriate to use to accurately measure urine output from a urinary retention catheter? A. Urinal. B. Graduate. C. Large syringe. D. Urine collection bag. Question 137. Answer: B. Graduate. Question 137. Explanation: a graduate is a collection container with volume markings, usually at 25 milliliters increments, that promote accurate measurements of urine volume. Although urinals have volume markings on the side, usually they occur in 100 milliliters increments that do not promote accurate measurements. Opt 1. Option 3 is impractical. A large syringe is used to obtain a sterile specimen from a retention catheter, Foley catheter. A urine collection bag is flexible and balloons outward as urine collects. In addition, the volume markings are at 100 milliliters increments that do not promote accurate measurements. Opt 4. Question 138. A patient's urine is cloudy, is amber, and has an unpleasant odor. What problem may this information indicate that requires the nurse to make a focused assessment? A. Urinary retention. B. Urinary tract infection. C. Ketone bodies in the urine. D. High urinary calcium level. Question 138. Answer: B. Urinary tract infection. Question 138. Explanation: the urine appears concentrated, amber and cloudy because of the presence of bacteria, white blood cells, and red blood cells. The unpleasant odor is caused by pus in the urine, pyuria. These clinical manifestations do not reflect urinary retention. Urinary retention is evidenced by suprapubic distension and lack of voiding or small, frequent voiding. Overflow incontinence. Opt 1. These clinical manifestations do not reflect ketone bodies in the urine. A reagent strip dipped in urine will measure the presence of ketone bodies. Opt 3. These clinical manifestations do not reflect excessive calcium in the urine. Urine calcium levels are measured by assessing a 24-hour urine specimen. Opt 4. Question 139. A nurse is caring for a debilitated female patient with nocturia. Which nursing intervention is the priority when planning to meet this patient's needs? A. Encouraging the use of bladder training exercises. B. Providing assistance with toileting every 4 hours. C. Positioning a bedside commode near the bed. D. Teaching the avoidance of fluid after 5 p.m. Question 139. Answer: C. Positioning a bedside commode near the bed. Question 139. Explanation: the use of a commode requires less energy than using a bedpan and is safer than walking to the bathroom. Sitting on the commode uses gravity to empty the bladder fully and thus prevent urinary stasis. Although option 1 should be done, it is not the priority. Option 2 may be too often or not often enough for the patient. Care should be individualized for the patient. Fluids may be decreased during the last 2 hours before bedtime, but they should not be avoided completely after 5 p.m. Opt 4. Some fluid intake is necessary for adequate renal perfusion. Question 140. A practitioner uses a urine specimen for culture and sensitivity via a straight catheter for a patient. What should the nurse do when collecting this urine specimen? A. Use a sterile specimen container. B. Collect urine from the catheter port. C. Inflate the balloon with 10 milliliters of sterile water. D. Have the patient void before collecting the specimen. Question 140. Answer: A. Use a sterile specimen container. Question 140. Explanation: A culture attempts to identify the microorganisms present in the urine, and a sensitivity study identifies the antibiotics that are effective against the isolated microorganisms. A sterile specimen container is used to prevent contamination of the specimen by microorganisms outside the body, exogenous. The urine from straight catheter flows directly into the specimen container. Collecting the urine specimen from the catheter port is necessary when the patient has a urinary retention catheter. Opt 2. A straight catheter has a single lumen for draining urine from the bladder. A straight catheter does not remain in the bladder and therefore does not have a second lumen for water to be inserted into a balloon. Opt 3. This may result in no urine left in the bladder for the straight catheter to collect. A minimum of 3 milliliters of urine is necessary for a specimen for urine culture and sensitivity. Opt 4. Question 141. A nurse in a provider's office is assessing a client who reports losing control of urine whenever she coughs, laughs, or sneezes. The client relates a history of 3 vaginal births, but no serious accidents or illnesses. Which of the following interventions are appropriate for helping to control or eliminate the client's incontinence? Select all that apply. A. Limit total daily fluid intake. B. Decrease or avoid caffeine. C. Increase the intake of calcium supplements. D. Avoid the intake of alcohol. E. Use Creed maneuver. Question 141. Answer: B. Decrease or avoid caffeine. D. Avoid the intake of alcohol. Question 141. Explanation: Caffeine and alcohol are bladder irritants and can worsen stress incontinence. Alcohol is a bladder irritant and can worsen stress incontinence. Because stress incontinence results from weak pelvic muscles and other structures, limiting fluid will not resolve the problem. Opt 1. Calcium has no effect on stress incontinence. Opt 3. The Creed maneuver helps manage reflex incontinence, not stress incontinence. Opt 5. Question 142. A client who has an indwelling catheter reports, "I need to urinate." Which of the following interventions should the nurse perform? A. Check to see whether the catheter is patent. B. Reassure the client that it is not possible for her to urinate. C. Recatheterize the bladder with a larger gauge catheter. D. Collect a urine specimen for analysis. Question 142. Answer: A check to see whether the catheter is patent. Question 142. Explanation: A clogged or kinked catheter causes the bladder to fill and stimulates the need to urinate. Reassuring the client that it is not possible to urinate is a non-therapeutic response because it diminishes the client's concern. Opt 2. There are less invasive approaches the nurse can take before replacing the catheter. Opt 3. Although it may become necessary to collect a urine specimen, there is a simpler approach the nurse can take to assess and possibly resolve the client's problem. Opt 4. Question 143. A provider prescribes a 24-hour urine collection for a client. Which of the following actions should the nurse take? A. Discard the first voiding. B. Keep all voidings in a container at room temperature. C. Ask the client to urinate and pour the urine into a specimen container. D. Ask the client to urinate into the toilet, stop midstream, and finish urinating into the specimen container. Question 143. Answer: A. Discard the first voiding. Question 143. Explanation: The nurse should discard the first voiding of the 24-hour urine specimen, and note the time. The nurse should collect all voidings after that and keep them in a refrigerated container. Opt 2. For a urinalysis, The nurse should ask the client to urinate and pour the urine into a specimen container, opt 3. For a culture, the nurse should ask the client to urinate first into the toilet, then stop midstream, and finish urinating in the specimen container, opt 4. Question 144. A nurse is preparing to initiate a bladder training program for a client who has a voiding disorder. Which of the following actions should the nurse take? Select all that apply. A. Establish a schedule of voiding prior to meal times. B. Have the client record voiding times. C. Gradually increase the voiding intervals. D. Reminded client to hold urine until next scheduled voiding time. E. Provide a sterile container for voiding. Question 144. Answer: B. Have the client record voiding times. C. Gradually increase the voiding intervals. D. Reminded client to hold urine until next scheduled voiding time. Question 144. Explanation: Ask the client to keep track of voiding times is an appropriate nursing action. Gradually increasing the voiding interval is an appropriate nursing action. The client should be reminded to hold urine until the next scheduled voiding time. Bladder training involves voiding at scheduled infrequent intervals and gradually increasing these intervals to 4 hours. Meal times are not regular, and the intervals may be longer than every 4 hours, opt 1. A sterile container is not used in a bladder training program, opt 5. Question 145. A nurse educator on a medical unit is reviewing factors that increase the risk of urinary tract infections with a group of assistive personnel. Which of the following should be included in the review? Select all that apply. A. Having sexual intercourse on a frequent basis. B. Lowering of testosterone levels. C. Wiping from front to back. D. The location of the vagina in relation to the anus. E. Undergoing frequent catheterization. Question 145. Answer: A. Having sexual intercourse on a frequent basis. D. The location of the vagina in relation to the anus. E. Undergoing frequent catheterization. Question 145. Explanation: Having sexual intercourse on a frequent basis is a factor that increases the risk of UTI in both males and females. The close proximity of the female urethra to the anus is a factor that increases the risk of UTIs. Undergoing frequent catheterization and the use of indwelling catheters are risk factors for UTIs. The decrease in estrogen levels during menopause increases a woman's susceptibility to UTIs, opt 2. Wiping from front to back decreases a woman's risk of UTIs, opt 3. Question 146. Clients should be taught that repeatedly ignoring the sensation of needing to defecate could result in which of the following? A. Constipation. B. Diarrhea. C. Incontinence. D. Hemorrhoids. Question 146. Answer: A. Constipation. Question 146. Explanation: Habitually ignoring the urge to defecate can lead to constipation through loss of the natural urge and the accumulation of feces. Diarrhea will not result. If anything, there is increased opportunity for water reabsorption because the stool remains in the colon, leading to firmer stool. Ignoring the urge shows a strong voluntary sphincter, not a weak one that could result in incontinence. Hemorrhoids would only occur if severe drying out of the stool occurs, and thus repeated need to strain to pass stool. Question 147. Which statement provides evidence that an older adult who is prone to constipation is in need of further teaching? A. I need to drink 1.5 to 2 quarts of liquid each day. B. I need to take a laxative such as milk of magnesia, or if I don't have a BM every day. C. If my bowel pattern changes on its own, I should call you. D. Eating my meals at regular times is likely to result in regular bowel movements. Question 147. Answer: B. I need to take a laxative such as milk of magnesia, or if I don't have a BM every day. Question 147. Explanation: The standard of practice in assisting the older adults to maintain normal function of the gastrointestinal tract is regular ingestion of a well-balanced diet, adequate fluid intake, and regular exercise. If the bowel pattern is not regular with these activities, this abnormality should be reported. Stimulant laxatives can be very irritating and are not the preferred treatment for occasional constipation in older adults. In addition, a normal stool pattern for an older adult may not be daily elimination. Question 148. A client is scheduled for a colonoscopy. The nurse will provide information to the client about which type of enema. A. Oil retention. B. Return flow. C. High large volume. D. Low, small volume. Question 148. Answer, D. Low, small volume. Question 148. Explanation. Small volume enemas along with other preparations are used to prepare the client for this procedure. An oil retention enema is used to soften hard stool. Return flow enemas help expel flatus because of the risk of loss of fluid and electrolytes. High, large volume enemas are seldom used. Question 149. The nurse is most likely to report which finding to the primary care provider for a client who has an established colostomy? A. The stoma extends 1/2 inch above the abdomen. B. The skin under the appliance looks red briefly after removing the appliance. C. The stoma color is a deep red purple. D. An ascending colostomy just delivers liquid feces. Question 149. Answer, C. The stoma color is a deep red purple. Question 149. Explanation. An established stoma should be dark pink like the color of the buccal mucosa and is slightly raised above the abdomen. The skin under the appliance may remain pink, red for a while after the adhesive is pulled off. Feces from an ascending ostomy are very liquid, less so from a transverse ostomy, and more solid from a descending or sigmoid stoma. Question 150. Which goal is the most appropriate for clients with diarrhea related to ingestion of an antibiotic for an upper respiratory infection? A. The client will wear a medical alert bracelet for antibiotic allergy. B. The client will return to his or her previous fecal elimination pattern. C. The client verbalizes the need to take an antidiarrheal medication (PRN). D. The client will increase intake of insoluble fiber such as grains, rice, and cereals. Question 150. Answer, B. The client will return to his or her previous fecal elimination pattern. Question 150. Explanation. Once the cause of diarrhea has been identified and corrected, the client to return to his or her previous elimination pattern. This is not an example of an allergy to the antibiotic but a common consequence of overgrowth of bowel organisms not killed by the drug. Antidiarrheal medications are usually prescribed according to the number of stools, not routinely around the clock. Increasing intake of soluble fiber such as oatmeal or potatoes may help absorb excess liquid and decrease the diarrhea, but insoluble fiber will not. Question 151. A client with a new stoma who has not had a bowel movement since surgery last week reports feeling nauseous. What is the appropriate nursing action? A. Prepare to irrigate the colostomy. B. After assessing the stoma and surrounding skin, notify the surgeon. C. Assess bowel sounds and administer antiemetic. D. Administer a bulk-forming laxative, and encourage increased fluids and exercise. Question 151. Answer, B. After assessing the stoma and surrounding skin, notify the surgeon. Question 151. Explanation. The client has assessment findings consistent with complications of surgery. Option A. Irrigating the stoma is a dependent nursing action, and is also intervention without appropriate assessment. Option C. Assessing the peristomal skin area is an independent action, but administering an antiemetic is an intervention without appropriate assessment. Antiemetics are generally ordered to treat immediate postoperative nausea, not several days postoperative. Option D. Administering a bulk-forming laxative to a nauseated postoperative client is contraindicated. Question 152. The nurse assesses a client's abdomen several days after abdominal surgery. It is firm, distended, and painful to palpate. The client reports feeling bloated. The nurse consults with the surgeon, who orders an enema. The nurse prepares to give what kind of enema? A. Soap suds. B. Retention. C. Return flow. D. Oil retention. Question 152 Answer, see Return flow. Question 152 Explanation. This provides relief of postoperative flatus, stimulating bowel motility. Options 1, 2, and 4 manage constipation and do not provide flatus relief. Question 153, which of the following is most likely to validate that a client is experiencing intestinal bleeding? A. Large quantities of fat mixed with pale yellow liquid stool. B. Brown, formed stool. C. Semi-soft tar-colored stools. D. Narrow, pencil-shaped stool. Question 153 Answer, C. Semi-soft tar-colored stools. Question 153 Explanation. Blood in the upper GI tract is black and tarry. Option 1 can be a sign of malabsorption in an infant, option 2 is normal stool, and option 4 is characteristic of an obstructive condition of the rectum. Question 154, which nursing diagnoses are most applicable to a client with fecal incontinence? Select all that apply. A. Bowel incontinence. B. Risk for deficient fluid volume. C. Disturbed body image. D. Social isolation. E. Risk for impaired skin integrity. Question 154 Answer, A. Bowel incontinence. C. Disturbed body image. D. Social isolation. E. Risk for impaired skin integrity. Question 154 Explanation. Option A is the most appropriate. The client is unable to decide when stool evacuation will occur. In option C, client thoughts about self may be altered if unable to control stool evacuation. In option E, increased tissue contact with fecal material may result in impairment. Option B is more appropriate for a client with diarrhea. Incontinence is the inability to control feces of normal consistency. Question 155. A nurse determines that a fracture bedpan should be used for the patient who, A. has a spinal cord injury. B. is on bed rest. C. has dementia. D. is obese. Question 155 Answer, A. has a spinal cord injury. Question 155 Explanation. A fracture bedpan has a low back that promotes function of the patient's lower back while on the bedpan. Question 156. A patient with the diagnosis of diverticulosis is advised to eat a diet high in fiber. What should the nurse recommend that the patient eat to best increase the bulk and fecal material? A. Whole wheat bread. B. White rice. C. Pasta. D. Kale. Question 156 Answer, D. Kale. Question 156 Explanation. Kale is an excellent source of dietary fiber. A serving of 3½ ounces of kale contains 6.6 grams of dietary fiber. One slice of whole wheat bread contains only 1.5 grams of dietary fiber. A serving of a 1/2 cup of white rice contains only 0.8 grams of dietary fiber. A serving of 3½ ounces of cooked pasta contains only 1.6 grams of dietary fiber. Question 157. Which statement by a patient with an ileostomy alert the nurse to the need for further education? A. I don't expect to have much of a problem with fecal odor. B. I will have to take special precaution to protect my skin around the stoma. C. I'm going to have to irrigate my stoma so I have a bowel movement every morning. D. I should avoid gas-forming foods like beans to limit funny noises from the stoma. Question 157 Answer, C. I'm going to have to irrigate my stoma so I have a bowel movement every morning. Question 157 Explanation. This statement is inaccurate in relation to an ileostomy and indicates that the patient needs more teaching. An ileostomy produces liquid fecal drainage that is constant and cannot be regulated. The odor from drainage is minimal because fewer bacteria are present in the ileum compared with the large intestine. An ileostomy is an opening into the ileum, distal small intestine from the jejunum to the cecum. Cleansing the skin barriers, and a well-fitted appliance are precautions to protect the skin around the ileostomy stoma. The drainage from ileostomy contains enzymes that can damage the skin. An ileostomy stoma does not have a sphincter that can control the flow of flatus or drainage, resulting in noise. Question 158. A practitioner orders a return flow enema, Harris flush drip, for an adult patient with flatulence. When preparing to administer this enema, the nurse compares the steps of a return flow enema with cleansing enemas. What should the nurse do that is unique to a return flow enema? A. Lubricate the last 2 inches of the rectal tube. B. Insert the rectal tube about 4 inches into the anus. C. Raise the solution container about 12 inches above the anus. D. Lower the solution container after instilling about 150 milliliters of solution. Question 158. Answer: D. Lower the solution container after instilling about 150 milliliters of solution. Question 158. Explanation: lowering the container of solution create a siphon effect that pulls the instilled fluid back out through the rectal tube into the solution container. The return flow promotes the evacuation of gas from the intestines. This technique is used only with a return flow enema. All rectal tubes should be lubricated to facilitate entry of the tube into the anus and rectum and prevent mucosal trauma. The anal canal is 1 to 2 inches long. Inserting the rectal tube 3 to 4 inches ensures that the tip of the tube is beyond the anal sphincter. This action is appropriate for all types of enemas. The solution container should be raised no higher than 12 inches for all enemas. This allows the solution to instill slowly, which limits discomfort and intestinal spasms. Question 159. A nurse discourages a patient from straining excessively when attempting to have a bowel movement. What physiological response primarily may be prevented by avoiding straining on defecation? A. Incontinence. B. Dysrhythmias. C. Fecal impaction. D. Rectal hemorrhoids. Question 159. Answer: B. Dysrhythmias. Question 159. Explanation: straining on defecation requires the person to hold the breath while bearing down. This maneuver increases the intrathoracic and intracranial pressures, which can precipitate dysrhythmias, brain attack, and respiratory difficulties. All of these can be life-threatening. The loss of the voluntary ability to control the passage of fecal or gaseous discharges through the anus is caused by impaired functioning of the anal sphincter or its nerve supply, not straining on defecation. Fecal impaction is caused by prolonged retention and the accumulation of fecal material in the large intestine, not straining on defecation. Although straining on defecation can contribute to the formation of hemorrhoids, this is not the primary reason straining on defecation is discouraged. Hemorrhoids, although painful, are not life-threatening. Question 160. A nurse is caring for a client who will perform fecal occult blood testing at home. Which of the following information should the nurse include when explaining the procedure to the client? A. Eating more protein is optimal prior to testing. B. One stool specimen is sufficient for testing. C. A red color changes indicates a positive test. D. The specimen cannot be contaminated with urine. Question 160. Answer: D. The specimen cannot be contaminated with urine. Question 160. Explanation: for fecal occult blood testing at home, the stool specimens cannot be contaminated with water or urine. Some proteins such as red meat, fish, and poultry can alter the test results. 3 specimens from 3 different bowel movements are required. A blue color indicates blood in the stool. Question 161. A nurse is talking with a client who reports constipation. When the nurse discusses dietary changes that can help prevent constipation, which of the following foods should the nurse recommend? A. Macaroni and cheese. B. Fresh food and whole wheat toast. C. Rice pudding and ripe bananas. D. Roast chicken and white rice. Question 161. Answer: B. Fresh food and whole wheat toast. Question 161. Explanation: a high-fiber diet promotes normal bowel elimination. The choice of fruit and toast is the highest fiber option. Macaroni and cheese is a low-residue option that could actually worsen constipation. Rice pudding and ripe bananas are low residue options that could actually worsen constipation. Roast chicken and white rice or low residue options that could actually worsen constipation. Question 162. A nurse is caring for a client who has diarrhea for the past 4 days. When assessing a client, the nurse should expect which of the following findings? Select all that apply. A. Bradycardia. B. Hypotension. C. Fever. D. Poor skin turgor. E. Peripheral edema. Question 162. Answer: B. Hypotension, C. Fever, D. Poor skin turgor. Question 162. Explanation: prolonged diarrhea lead to dehydration, which causes a decrease in blood pressure. Prolonged diarrhea leads to dehydration, which causes fever. Prolonged diarrhea is more likely to cause tachycardia than bradycardia. Peripheral edema results from a fluid overload. Prolonged diarrhea is more likely to cause a fluid deficit. Question 163. A nurse is preparing to administer a cleansing enema to an adult client in preparation for a diagnostic procedure. Which of the following are appropriate steps for the nurse to take? Select all that apply. A. Warm the enema solution prior to installation. B. Position the client on the left side with the right leg flexed forward. C. Lubricate the rectal tube or nozzle. D. Slowly insert the rectal tube about 2 inches. E. Hang the enema container 24 inches above the client's anus. Question 163. Answer: A. Warm the enema solution prior to installation. B. Position the client on the left side with the right leg flexed forward. C. Lubricate the rectal tube or nozzle. Question 163. Explanation: The nurse should warm the enema solution because cold fluid can cause abdominal cramping and hot fluid can injure the intestinal mucosa. Option B allows a downward flow of solution by gravity along the natural anatomical curve of the sigmoid colon. Lubrication prevents trauma or irritation to the rectal mucosa. Option D is an appropriate length of insertion for a child. For an adult client, the nurse should insert a tube 3 to 4 inches. The height of the fluid container affects the speed of installation. The maximum recommended height is 163 inches. Hanging the container higher than that could cause rapid installation and possibly painful distension of the colon. Question 164. While a nurse is administering a cleansing enema, the client reports abdominal cramping. Which of the following is the appropriate intervention? A. Have a client hold his breath briefly. B. Discontinue the fluid installation. C. Remind the client that cramping is common at this time. D. Lower the enema fluid container. Question 164. Answer: D. Lower the enema fluid container. Question 164. Explanation: To relieve the client's discomfort, the nurse should slow the rate of installation by reducing the height of the enema solution container. Taking slow, deep breaths is more therapeutic for easing discomfort than holding the breath. The nurse should stop the installation if the client's abdomen becomes rigid and distended or if the nurse notes bleeding from the rectum. Option C is not therapeutic as it implies that the client must tolerate the discomfort and that the nurse cannot or will not do anything to ease it. Question 165. A client with chronic pulmonary disease has a bluish tinge around the lips. The nurse charts which term to most accurately describe the client's condition? A. Hypoxia. B. Hypoxemia. C. Dyspnea. D. Cyanosis. Question 165. Answer: D. Cyanosis. Question 165. Explanation: A bluish tinge to mucous membranes is called cyanosis. This is most accurate because it is what the nurse observes. The nurse can only observe signs, symptoms of hypoxia. More information is needed to validate this conclusion. Hypoxemia requires blood oxygenation saturation data to be confirmed and dyspnea is difficulty breathing. Question 166. To prevent postoperative complications, Nurse Kim assists the client with coughing and deep breathing exercises. This is best accomplished by implementing which of the following? A. Coughing exercises 1 hour before meals and deep breathing 1 hour after meals. B. Forceful coughing as many times as tolerated. C. Huff coughing every 2 hours or as needed. D. Diaphragmatic and pursed lip breathing 5 to 10 times, 4 times a day. Question 166. Answer: C. Huff coughing every 2 hours or as needed. Question 166. Explanation: Huff coughing helps keep the airways open and secretions mobilized. Huff coughing is an alternative for clients who are unable to perform a normal forceful cough, such as postoperatively. Deep breathing and coughing should be performed at the same time. Only at mealtimes is not sufficient. Option 166. Extended forceful coughing fatigues the client, especially postoperatively. Option 2. Diaphragmatic and pursed lip breathing are techniques used for clients with obstructive airway disease. Option 4. Question 167. Nurse Trixie is preparing to perform tracheostomy care. Prior to beginning the procedure, the nurse performs which action? A. Tells the client to raise 2 fingers to indicate pain or distress. B. Changes twill tape holding the tracheostomy in place. C. Cleans the incision site. D. Checks the tightness of the ties and knot. Question 167. Answer: A. Tells the client to raise 2 fingers to indicate pain or distress. Question 167. Explanation: Prior to starting the procedure, it is important to develop a means of communication by which the client can express pain or discomfort. The twill tape is not changed until after performing tracheostomy care. Option 167. Cleaning the incision should be done after cleaning the inner cannula. Option 3. Checking the tightness of the ties and knot is done after applying new twill tape. Option 4. Question 168. Which action by the nurse represents proper nasopharyngeal, nasotracheal suctioning technique? A. Lubricate the suction catheter with petroleum jelly before and between insertion. B. Apply suction intermittently while inserting the suction catheter. C. Rotate the catheter while applying suction. D. Hyperoxygenate with 100% oxygen for 30 minutes before and after suctioning. Question 168. Answer: C. Rotate the catheter while applying suction. Question 168. Explanation: Rotating the catheter prevents pulling of tissue into the opening on the catheter tip and the side. Suction catheters may only be lubricated with water or water-soluble lubricant, and petroleum jelly such as Vaseline has an oil base. Option 1. No suction should ever be applied while the catheter is being inserted because this can traumatize tissues. Option 2. The client should be hyperoxygenated for only a few minutes before and after suctioning, and this is generally limited to clients who are intubated or have a tracheostomy. Option 4. Question 169. Which client statement informs the nurse that his teaching about the proper use of an incentive spirometer was effective? A. I should breathe out as fast and as hard as possible into the device. B. I should inhale slowly and steadily to keep the balls up. C. I should use the device 3 times a day, after meals. D. The entire device should be washed thoroughly in sudsy water once a week. Question 169. Answer: B. I should inhale slowly and steadily to keep the balls up. Question 169. Explanation: Proper use of an SMI requires the client to take slow, steady inhalations, every hour or two, 5 to 10 reps each time. Only the mouthpiece can be successfully rinsed or wiped clean. The device should not be submerged in water. Option 169. Question 170. While a client with chest tubes is ambulating, the connection between the tube and the water seal dislodges. Which action by Nurse Flora is most appropriate? A. Assist the client to ambulate back to bed. B. Reconnect to the tube to the water seal. C. Assess the client's lung sounds with a stethoscope. D. Have the client cough forcibly several times. Question 170. Answer: B. Reconnect to the tube to the water seal. Question 170. Explanation: The tube should be reconnected to the water seal as quickly as possible. assisting the client back to bed, option 1, and assessing the client's lung, option 3, are possible actions after the system is reconnected. Question 171. Nurse Peter makes the assessment that which client has the greatest risk for a problem with the transport of oxygen from the lungs to the tissues? A client who has A. Anemia, B. An infection, C. A fractured rib, D. A tumor of the medulla. Question 171. Answer: anemia. Question 171. Explanation: anemia is a condition of decreased red blood cells and decreased hemoglobin. Hemoglobin is how the oxygen molecules are transported to the tissues. Option 2 would depend on where the infection is located. Option 3, a fractured rib would interrupt transport of oxygen from the atmosphere to the airways. Option 4, damage to the medulla would interfere with neural stimulation of the respiratory system. Question 172, which term does the nurse document to best describe a client experiencing shortness of breath while lying down who must assume an upright or sitting position to breathe more comfortably and effectively? A. dyspnea, B. hyperpnea, C. orthopnea, D. acapnea. Question 172. Answer: C. orthopnea. Question 172. Explanation: respiratory difficulty related to a reclining position without other physical alterations is defined as orthopnea. Question 173. A client with emphysema is prescribed corticosteroid therapy on a short-term basis for acute bronchitis. The client asks the nurse how the steroids will help him. The nurse responds by saying that the corticosteroids will do which of the following? A. Promote bronchodilation, B. Help the client to cough, C. Prevent respiratory infection, D. Decrease inflammation in the airways. Question 173. Answer: D. Decrease inflammation in the airways. Question 173. Explanation: glucocorticoids are prescribed because of their anti-inflammatory effect. Options 1, 2, and 4 are not achieved with glucocorticoids. The nurse is planning to perform percussion and postural drainage, which is an important aspect of planning the client's care. 1. Percussion and postural drainage should be done before lunch. Question 174. Nurse Ali is planning to perform percussion and postural drainage, which is an important aspect of planning the client's care. A. Percussion and postural drainage should be done before lunch. B. The order should be coughing, percussion, positioning, and then suctioning. C. A good time to perform percussion and postural drainage is in the morning after breakfast when the client is well rested. D. Percussion and postural drainage should always be preceded by 3 minutes of 100% oxygen. Question 174. Answer: a percussion and postural drainage should be done before lunch. Question 174. Explanation: postural drainage result in expectoration of large amounts of mucus. Client sometimes ingest part of the secretions. The secretions may also produce an unpleasant taste in the oral cavity, which could result in nausea, vomiting. This procedure should be done on an empty stomach to decrease client discomfort. Question 175. Nurse Winona teaches a patient how to use an incentive spirometer. What patient outcome will support the conclusion that the use of the incentive spirometer was effective? A. Supplemental oxygen use will be reduced. B. Inspiratory volume will be increased. C. Sputum will be expectorated. D. Coughing will be stimulated. Question 175. Answer: B. Inspiratory volume will be increased. Question 175. Explanation: an incentive spirometry or provides a visual goal for and measurement of inspiration. It encourages the patient to execute and maintain a sustained inspiration. A sustained inspiration opens airways, increases the inspiratory volume, and reduces the risk of atelectasis. Patients who use an incentive spirometer may or may not be receiving oxygen. Option 1. Although sputum may be expectorated after the use of an incentive around mature, This is not the primary reason for its use. Option 3. Although the deep breathing associated with the use of an incentive barometer may stimulate coughing, this is not the primary reason for its use. Option 4. Question 176. Nurse AJ is applying a warm compress. What should the nurse explain to the patient is the primary reason why heat is used instead of cold? A. Minimizes muscle spasms. B. Prevents hemorrhage. C. Increases circulation. D. Reduces discomfort. Question 176. Answer: C. Increases circulation. Question 176. Explanation: heat increases the skin surface temperature, promoting vasodilation, which increases blood flow to the area. Cold has the opposite effect. It promotes vasoconstriction, which decreases blood flow to the area. Both heat and cold relax muscles and thus minimize muscle spasms. There is no advantage to using heat over cold. Option 1. Heat does not prevent hemorrhage, heat causes vasodilation, which promotes hemorrhage. Option 2. Both heat and cold can reduce discomfort. Cold reduces discomfort by numbing the area, slowing the transmission of pain impulses, and increasing the pain threshold. Heat reduces the discomfort by relaxing the muscles. Option 4. Question 177. A practitioner orders chest physiotherapy with percussion and vibration for a newly admitted patient. Which information obtained by the nurse during the health history should alert the nurse to question the practitioner's order? A. Emphysema. B. Osteoporosis. C. Cystic fibrosis. D. Chronic bronchitis. Question 177. Answer: B. Osteoporosis. Question 177. Explanation: implementing the practitioner's order may compromise patient's safety because percussion and vibration in the presence of osteoporosis may cause fractures. Osteoporosis is an abnormal loss of bone mass and strength. Option 1. These are appropriate interventions for a patient with emphysema. Emphysema is a chronic pulmonary disease characterized by an abnormal increase in the size of air spaces distal to the terminal bronchioles with destructive changes in their walls. Option 3. These are appropriate interventions for a patient with cystic fibrosis. Cystic fibrosis causes widespread dysfunction of the exocrine glands. It is characterized by thick, tenacious secretions in the respiratory system that block the bronchioles, creating breathing difficulties. Option 4. These are appropriate interventions for a patient with chronic bronchitis. Bronchitis is an inflammation of the mucous membranes of the bronchial airways. Question 178. Nurse Sue teaches a patient about pursed lip breathing. The nurse identifies that the teaching is affected when the patient says its purpose is to A. Precipitate coughing. B. Help maintain open airways. C. Decrease intrathoracic pressure. D. Facilitate expectoration of mucus. Question 178. Answer: B. Help maintain open airways. Question 178. Explanation: pursed lip breathing involves deep inspiration and prolonged expiration against slightly closed lips. The pursed lips create a resistance to the air flowing out of the lungs, which prolongs exhalation and maintains positive airway pressure, thereby maintaining an open airway and preventing airway collapse. Deep breathing and huff coughing, not pursed lip breathing, stimulate effective coughing. Option 1. Pursed lip breathing increases, not decreases intrathoracic pressure. Option 3. The huff coughing stimulates the natural cough reflex and is effective for clearing the central airways of sputum. Saying the word huff with short forceful exhalations keeps the glottis open, mobilizes sputum, and stimulates a cough. Option 4. Question 179. What should Nurse Mavi do first if a patient is choking on food? A. Apply sharp four thrusts over the patient's xiphoid process. B. Determine if the patient can make any verbal sounds. C. Hit the middle of the patient's back firmly. D. Sweep the patient's mouth with a finger. Question 179. Answer: B. Determine if the patient can make any verbal sounds. Question 179. Explanation: When a person is choking on food, the first intervention is to determine if the person can speak, because the next intervention will depend on if it is a partial or total airway obstruction. With a partial airway obstruction, the person will be able to make sounds because some air can pass from the lungs through the vocal cords. In this situation, the person's own efforts (gagging and coughing) should be allowed to clear the airway. With a total airway obstruction, the person will not be able to make a sound because the airway is blocked, and the nurse should immediately initiate the abdominal thrust maneuver, Heimlich maneuver. Thrusts to the xiphoid process may cause a fracture that may result in a pneumothorax. Option 1, question 180. Nurse Stephanie is assessing a client who has an acute respiratory infection that puts her at risk for hypoxemia. Which of the following findings are early indications that should alert the nurse that the client is developing hypoxemia? Select all that apply. A. Restlessness. B. Tachypnea. C. Bradycardia. D. Confusion. E. Pallor. Question 180. Answer: A. Restlessness. B. Tachypnea. E. Pallor. Question 180. Explanation: Restlessness, tachypnea, and pallor are early manifestations of hypoxemia, along with tachycardia, elevated blood pressure, use of accessory muscles, nasal flaring, tracheal tugging, and adventitious lung sounds. Bradycardia and confusion are late manifestations of hypoxemia, along with stupor, cyanotic skin and mucous membranes, bradypnea, hypotension, and cardiac dysrhythmias. Question 181. Nurse CJ is caring for a client who is having difficulty breathing. The client is lying in bed and is already receiving oxygen therapy via nasal cannula. Which of the following interventions is the nurse's priority? A. Increase the oxygen flow. B. Assist the client to Fowler's position. C. Promote removal of pulmonary secretions. D. Attain a specimen for arterial blood gases. Question 181. Answer: B. Assist the client to Fowler's position. Question 181. Explanation: The priority action the nurse should take when using the airway, breathing, circulation approach to care delivery is to relieve the client's dyspnea. Fowler's position facilitates maximal lung expansion and thus optimizing breathing. With the client in this position, the nurse can better assess and determine the cause of the client's dyspnea. Option 1, the client may need more oxygen, as hypoxemia may be the cause of his difficulty breathing. However, administering oxygen and adjusting the fraction of inspired oxygen requires the provider's prescription after a careful assessment of the client's oxygenation status. There is a higher priority given the nature of the client's distress. Option 3, the client may need suction or expectoration, as pulmonary secretions may be the cause of his difficulty breathing. However, there is a higher priority given the nature of the client's distress. Option 4, it is important to check the client's oxygenation status, and in many nursing situations, assessment precedes action, but there is a higher priority given the nature of the client's distress. Question 182, Nurse Aldrin is preparing to perform endotracheal suctioning for a client. Which of the following are appropriate guidelines for the nurse to follow? Select all that apply. A. Apply suction while withdrawing the catheter. B. Perform suctioning on a routine basis, every 2 to 3 hours. C. Maintain medical asepsis during suctioning. D. Use a new catheter for each suctioning attempt. E. Limit suctioning to 2 to 3 attempts. Question 182. Answer: Apply suction while withdrawing the catheter. D. Use a new catheter for each suctioning attempt. E. Limit suctioning to 2 to 3 attempts. Question 182. Explanation: The nurse should apply suction pressure only while withdrawing the catheter, not while inserting it. The nurse should not reuse the suction catheter unless an inline suctioning system is in place. To prevent hypoxemia, the nurse should limit each section in session to 2 to 3 attempts and allow at least 1 minute between passes for ventilation and oxygenation. The nurse should not suction routinely because suctioning is not without risk. It can cause mucosal damage, bleeding, and bronchospasm. Endotracheal suctioning requires surgical asepsis. Question 183. A nurse is caring for a client who has a tracheostomy. Which of the following actions should the nurse take each time he provides a tracheostomy care? Select all that apply. A. Apply the oxygen source loosely if the SpO2 increases during the procedure. B. Use surgical asepsis to remove and clean the inner cannula. C. Clean the outer surfaces in a circular motion from the stoma side outward. D. Replace the tracheostomy ties with new ties. E. Cut a slit in gauze squares to place beneath the tube holder. Question 183. Answer. Apply the oxygen source loosely if the SpO2 increases during the procedure. B. Use surgical asepsis to remove and clean the inner cannula. C. Clean the outer surfaces in a circular motion from the stoma side outward. Question 183. Explanation. The nurse must be prepared to provide supplemental oxygen in response to any decline in oxygenation saturation while performing tracheostomy care. The nurse should use a sterile disposable tracheostomy cleaning kit or sterile supplies and maintain surgical asepsis throughout this part of the procedure. Option 3 helps move mucus and contaminated material away from the stoma for easy removal. Option 4, to help keep the skin clean and dry, the nurse should replace the tracheostomy ties if they are wet or soiled. There is a risk of tooth dislodgement with replacing the ties, so he should not replace them routinely. Option 5, the nurse should use a commercially prepared tracheostomy dressing with a slit in it. Cutting gauze squares can loosen lint or cause fibers the client could aspirate. Question 184. An elderly nursing home resident has refused to eat or drink for several days and is admitted to the hospital. The nurse should expect which assessment finding? A. Increased blood pressure. B. Weak, rapid pulse. C. Moist mucous membranes. D. Jugular vein distension. Question 184. Answer. B. Weak, rapid pulse. Question 184. Explanation. All other options are indicated of fluid volume excess. A client who has not eaten or drunk anything for several days would be experiencing fluid volume deficit. Question 185. A man brings his elderly wife to the emergency department. He states that she has been vomiting and has had diarrhea for the past 2 days. She appears lethargic and is complaining of leg cramps. What should the nurse do first? A. Start and 4. B. Review the results of serum electrolytes. C. Offer the woman foods that are high in sodium and potassium content. D. Administer an antiemetic. Question 185. Answer. B. Review the results of serum electrolytes. Question 185. Explanation. Further assessment is needed to determine appropriate action. While the nurse may perform some of the interventions in options 1, 3, and 4, assessment is needed initially.